So for any counseling station, especially like the epilepsy, we start our management by saying there are some things that we will do and some other things you will do to him or you will take care of. What we are going to do, we're going to prescribe the medication. And similar to exactly to the adult epilepsy, we will advise about that he should take it every day in the same time, and he should take it regularly as well, and no drug interaction. You know what, the sodium valproate always interacts with some other drugs, so it's better to seek medical advice before starting it. And I will warn about side effects, definitely after opening the BNF, which are side effects like some headache, some weight gain, some hair loss, some diarrhea, some liver problem. They are temporary, and we are going to monitor him or her. What else? Okay, what are the things that she should do herself? We're going to advise her about the triggering factors. What are the triggering factors in this case? The triggering factors are very similar to the adults. Actually, it is very similar. Like what? Lack of sleep. But of course, I will not speak about alcohol. No alcohol here. So lack of sleep, dehydration, skipping meals. What else? Very important thing is TV and video games. Video games can precipitate a seizure. So TV and video games could be lack of sleep, could be dehydration, could be skipping meals, could be as well excessive exercise. Excessive exercise, strenuous physical exercise are important as well. Actually, this girl or this boy or this child, they spend too much time in front of TV and they sleep well, but sometimes they do not drink plenty of water, and some other times as well they do swimming classes and dance classes as well. So they do swimming and dance. So regarding the swimming, I'm going to advise that you should swim or he should swim in shallow water, and he should. I mean, his instructor, his safeguard or his lifeguard should know about this. Should know about his condition. And regarding dance classes, I'll advise that it should not be strenuous and no loud music nor voice. Again, no loud music nor voice, and no strenuous exercise or no strenuous dance. Okay, what are the warning signs? Of course, if it happens, recovery position, remove any sharp objects, and do not put anything in the mouth. Okay, uh, she will ask you one question, doctor, does it cause damage to the brain? Actually, here the duration of the fit was not long. The duration of the fit actually, when it's long, there is high chance of high chance of imposing a threat to the brain. But here it was just short fit, so there is no damage happens to the brain. She will ask you, doctor, will she be able to have a normal life? Okay, you simply tell her that if he takes the medication or if she takes the medication and avoid the triggering factors, typically they will have normal life. What precautions should I look for? Precautions are again the medications and triggering factors, but you can also add in the end that shower is better than baths, and electric-based things are better than heat-based, similar to the adult exactly. Okay, now you know that this is pediatric. In any pediatric problem like neurological or psychiatric problem or any medical health problem, actually you should speak to the teacher, I mean to the nursery school, to inform them about their condition, about the child condition. Why? Because it's very important they know about it, otherwise it will be stressful to him or her. And they should know that in case anything happens. So these are the warning signs. Okay, this is regarding the epilepsy. Has anyone got any question? I see it's very similar to the adult. Very similar. Apart from the last 2 or 3 questions, it will pose no threat to the brain, and they can have normal life thanks to the medication and triggering factors avoidance. And what they should look for always, you should also tell the teacher or tell the nursery school. Okay, so this is regarding the epilepsy station. Next station is one easy station. It is otitis media. let me open the task for you because I see it's very easy as well. The patient is 50, if I told pediatrics, definitely the patient is 15 months old girl, and she was brought to the hospital because of fever. So she has also been pulling her right ear. GP has seen the baby and the GP note. In the GP note, it is written the vitals, and in the vitals you can find that there is fever, and there is tachycardia, and there is tachypnea as well. And the baby was given paracetamol. And on examination, there is redness in the right ear. Redness only in the right ear. So now from the task, you know that it is otitis media in child. This station is very easy and it does not come so frequently, but it comes. It does not come so frequently, but still you have to know it because it's very easy. I mean, that's you know otitis media from outside. The only trick here is to know about the duration, as I told you before. Can anyone tell me about the duration before? What is the importance of the duration of the onset or the onset of the symptoms? Can anyone tell me? Dr. Zaid, can you tell me?
Otitis media of duration?
What is the importance of the duration in this case in otitis media? Yes, I see that they said that 4 days. If less than 4 days, yes, after 4 days.
Yeah, for complications.
Exactly. 4 days or more, I will start antibiotics. Less than 4 days, no antibiotics. Okay, so here simply you will find that the main complaint fever, and the mother is very worried. So when someone is worried, no, in the children, Dr. Elvira, it's 4 days. Okay, we'll speak about it right now. When someone is very worried, please reassure her that we're all here to help her or him. Okay. Okay, Dr. Elvira, I need you to come to elaborate this with me in 2 minutes, quickly. I need you to tell me many things. Number one, what is the what will I ask after the fever? Number two, what are the DDs here? Number three, which examinations? Quickly, Dr. Elvira.
Hello, everyone. Fever, we asked what was the exact temperature, and did child have rash? Was he shy away from
Dr. Elvira, I need the associating symptoms of the otitis media first.
Yeah, it was child pulling his ear. Was there any discharge?
Okay, what else?
So I don't know. Was he crying?
Okay, good. What else?
So he will have a general. The child will always have a sort of general.
You know what are the signs of infection in children?
Yes, temperature.
Yeah.
Fever.
Yeah, temperature and fever. Wow, I'm excited. Temperature and fever.
I thought it was. Yeah.
Okay, let me tell you something, Dr. Elvira. I need you to keep this approach in your mind for any pediatric station. Okay, whenever you are suspecting any infection, ask about number one, fever. Number two, poor feeding. Number three, crying. Number four, lethargy. Lethargy is asked like, is he playful like before? So again, fever, crying, poor feeding, and lethargy.
Okay.
When you are suspecting otitis media, you are not going to ask the mom, has she had any pain in his ear? She will tell you, how would I know? Okay, just simply ask her, have he had any pulling to the ear? Pulling the ear is more significant. Okay?
Yes.
This is number one. Number two, so these are the signs of the infection for the otitis media to confirm it. So fever, pulling the ear, poor feeding, crying, not playful, like before. And by the way, these signs will all be positive in this station. So elaborate each of them, like for example, when did it start and has it changed? Only two questions are enough. When did it start? Has it changed? For any symptom, you have to ask this question: when did it start and has it changed? Dr. Elvira,
Yes.
you can also ask about any redness or hotness in the ear.
Okay.
What if she interrupts you in the middle and she asks you, doctor, can you please prescribe antibiotics to her?
Before prescribing any antibiotics, I will have to examine the child.
Why you keep your voice low? Are you shy?
I'm not shy.
Okay, tell me.
Let me get another. Yeah, before prescribing antibiotics, we have to examine the child.
Okay, very good. So just
see
let me.
does he
no,
need it or not?
No, yes,
Okay.
exactly. So definitely, I will. Let me ask you two more questions, and if needed, I can prescribe antibiotics. No problem. Okay. What are the differentials here, Dr. Elvira?
Differentials.
Yeah. You can take your time, Dr. Elvira, if you are busy. If you,
No.
take your time.
Differentials here, otitis media. So we'll have to find out. Maybe this just chest infection going on at the same time.
Okay, very good.
And just a simple.
How to ask about chest infection? How to ask about chest infection?
Did you notice the child was child coughing last few days by any chance?
Okay, very good. What
Did
else?
you notice that he was short of breath? He wasn't feeding poorly.
Very good. What is the other red flag, or what is the other DD?
Meningitis, of course.
Okay, very good. So how to ask about meningitis in children?
Did you notice that your child would be crying when he moves his neck? Did you notice that your child is shy away from the light? Any rush on any part of his body?
Exactly. This is pretty good. So now the DDs are very enough to ask about respiratory tract infection and meningitis. You can also you can ask about UTI, one question only, like any change in the urine. Now you can ask about medical conditions, or no, you can ask about PMH. Okay, in the PMH, ask in the medical conditions only. You can ask about diabetes, any high blood sugar. Why? Because diabetes is a strong association with otitis media as well. And now move to the bird questions. Bird questions are, bird immunity or jabs, and happy with red book. Any problem with the wee? Any problem with the poo? One question not to miss in the ear problem. What is the most important question that we need to ask in any ear problem, Dr. Elvira?
If child has a recurrent ear infection, you have to ask that no one smokes at home.
Excuse me?
If the child having a recurrent ear infection, the smoking is very important at home. And also.
You mean smoking? You mean someone smokes beside him?
Yes, yeah.
Not he smoke.
No, of course not his. I mean, either of the parents smokes, but it's really it is the case here.
Yeah, exactly. Okay, so exactly.
In Egypt, not many people smoke.
No, many people smoke here. But okay, I have to tell you something. More importantly, is swimming, because in UK most of the children go swimming, right?
Yes, that's correct. Yeah.
Okay,
that would be in psychosocial.
No, psychosocial. Oh yes, you can ask about it after the bird questions. I mean. Bird questions are after it. You can ask about swimming and passive smoking. Okay. Okay. Let's do bless. Let's do some examinations, Dr. Elvira. Which examinations you're going to do here?
We will check the ear. We'll look.
ENT examination.
Yes, yeah.
Yeah, okay. And by the way, the examiner will tell you, doctor, examinations are similar to your task. Okay, you can mute yourself right now, Dr. Elvira.
Yeah, I'm busy. Okay.
No problem.
You. I'm sorry.
No, it's fine. It's fine. It's absolutely fine. I'm really sorry. So, what's going on? Your daughter is having a condition we call acute otitis media, or otitis media, very enough. What is its inflammation or infection in the middle ear? What is the middle ear, by the way? Eardrum? and the space behind the eardrum. So what is the middle ear? It is the eardrum and space behind it. Okay. Okay. How did she get it? Simply through upper respiratory tract infection. She will give you history of upper respiratory tract infection. Yes, you will mention the examinations verbally only. The examiner will tell you, doctor, examinations are similar to your test. Yes, one more thing, do not forget to do respiratory examination as well. In any ear problem, you have to do respiratory examination because most probably the cause here or the root cause here is respiratory. Okay. Um, how did she get it? She will give you history of upper respiratory tract infection, which happened a few weeks back, a few days back. You will simply say that it's linked due to the cold. The cold travels from the throat to the middle ear, actually. Okay, and that's why it happens anyway. The otitis media. Is it serious? You will simply tell her that it will clear within a few days. By the way, here, you know what? Let me tell you something. She can give you two scenarios. She can give you if the symptoms started 2 days ago, some other time since 4 days. Well, mostly it will be since 2 days. So she'll ask you, doctor, can you give him antibiotics? Simply say that it will resolve on its own without treatment. Okay? So again, you'll say that it usually resolves on its own without treatment because having antibiotics unnecessarily can bring resistance and can cause some side effects. So we are going to prescribe something for the fever or for the pain. Very enough. What if 4 or more days? 4 or more days you will definitely prescribe antibiotic. Which antibiotic? Most probably amoxicillin, and if allergy, you will prescribe clarithromycin. Do not confuse yourself. Open the BNF. If you are, or just stay in the end. And however, I will check with my book. Doctor, what can you do for hair? Okay, simply it can be cleared on its own. We are going to give medication to the fever or for the pain. Okay, drink plenty of water as well. So with any fever, I always give antipyretic and advice about water drinking. Warning signs. If the symptoms did not improve within 2 days from now, and if she developed any more symptoms, like what? Like maybe shyness of the light, like maybe severe cough, like something like this, we definitely would prescribe antibiotics. So the warning signs here are signs of meningitis and signs of pneumonia. And if her symptoms did not improve within 2 days, we need to prescribe antibiotics. Any confusion here? Anyone is confused about something?
Dr. Ahmed, should we mention the neurological examination in the
You can mention it to rule out meningitis. Yes, you can mention it. No problem. You can mention it. I mean, usually the examiner will tell you the moment you will say examinations, the examiner will tell you, doctor, all the examinations are similar to your task. Because the task, it's mentioned that there have been rise in the vitals, the temperature, and tachycardia, and there is problem in the right ear, like redness or swelling in the right ear. I hope you got it.
Dr. Ahmed?
Yes?
There is a case of upper respiratory tract infection.
The adult, it's adult, right?
Well, I'm not quite sure. Maybe adult, yes.
Yeah. She was. We discussed it in the medicine station.
Adult.
Yes.
Right.
It is adult, and she wants antibiotic, or he wants antibiotic from the beginning.
He wants antibiotic.
Yeah. Well, you know why? Because his symptoms have been there for more than 4 days, and they did not resolve. So you just take some history from him because he came to the GP a few days ago. You will take some history from him, and you will say to him that he is not fit to receive antibiotics, or he is not supposed to receive antibiotics. You know why? Because simply this is self-limiting problem, and it takes up to 2 weeks to be cleared away. However, if he develops any complaint, we will definitely prescribe antibiotics. By the way, in this test, swab has been taken from the throat or from the nose, and it showed viral infection. So this is another reason that you're not going to give him antibiotics. The swab showed viral infection. Number 2, upper respiratory tract infection is self-limiting. Okay. Number 3, always say the sentence, prescribing antibiotics unnecessarily can give some side effects and can develop resistance later. Okay. Okay. Next station is respiratory distress in a child. The respiratory distress in a child, it is an asthma station. First of all, he is 7 years old. 7 years old means that the likelihood of asthma is high. Do not say bronchiolitis. You know how to differentiate bronchiolitis from asthma? Most probably by the age. They are both very similar, but the age makes difference. If the age is less than 1 year, I barely say asthma. I just say bronchiolitis. So bronchiolitis is the asthma, but under 1 year, because asthma is mostly diagnosed after 1 year. Okay, so here he is 7 years old, presented because of an episode of shortness of breath. He had 2 previous episodes in the past. So this is another reason. 2 previous episodes in the past. So now I can diagnose asthma safely. You know, asthma usually is repeated. I cannot diagnose it from the first episode. Talk to the mother and take history and discuss the management plan. What will be the presenting complaint? The presenting complaint is shortness of breath and wheeze. She will tell you both things. Is there any other disease in the medicine which is having shortness of breath and wheeze? I mean, apart from the anaphylaxis and the asthma? Doctor, now let's pick up on someone else. I need to pick up on someone like maybe Dr. Maria. How are you today? By the way, Dr. Fungzi, you are next because you were not asking before. And Dr. Murad as well today, and Dr. Nigar. Hello, Dr. Maria.
Hello.
I cannot hear your voice.
Oh, now you can?
Yeah, that's fine. Dr. Maria, I'm having shortness of breath and wheeze. Tell me how to elaborate each of them.
Okay. Since when you have the shortness of
Liar,
breath?
liar, I will kill you.
No?
How
No?
do I start asking?
Seriously?
Dr. Maria,
When it started?
Dr. Maria, is this your first question regarding any episode or regarding any complaint?
Long term? Okay. Anything else?
Dr. Maria, I'm having
Okay.
shortness of breath.
Start. Oh, okay. I got it. Okay. Are you comfortable to talk to me?
Okay, suppose that the child, you are talking to the mother right now. You are not talking to the child.
Oh, okay. So what shall I say? How has this affected his life? But
Really?
this should be in
This
last.
is
No.
this is the first
Oh my
question I
God.
ask into the patient. Dr.
I
Maria,
think I'm
concentrate.
having aura right now.
No, concentrate. Calm down. Just tell me. You know, we always ask
Okay.
open question first. Like what?
Yeah. Tell me something more about it.
Not tell me something. Just tell me more.
Oh, okay.
Okay,
Tell
can
me
you
more.
tell me more? Can I tell me more about it, please? She will tell you, doctor. It started this morning, doctor, and she will describe to you the whole situation. That the child, he was drawing his muscles inward. He was struggling or he's fighting to take breath, and he was shrinking his shoulder. Okay, and doctor, no. So now she described to you. You have to ask her also, has it changed? Anything makes it better? Anything makes it worse? Okay, now, first of all, what are the questions for any complaint? When did it start? I'm writing it. Has it changed? Anything makes better? Anything makes worse? Do not skip any complaint unless you ask at least these questions. If you skip any complaint without asking these questions about one of them, you will be missing some marks in the exam. Because do not take any word from the patient like for granted. You have to elaborate each and everything the patient tells you. Okay? Dr. Maria, you are still there, by the way. I did not release you.
Yeah. Yeah, I'm still here.
Okay, so she will tell you she's very worried, actually, as Dr. Zaid is saying. So please, when someone's worried, what are you going to do, Dr. Maria?
Okay, I can see you're very much worried, but we are here to help and support you.
Perfect, Dr. Maria. So what shortness of breath she gave you also wheeze. How are you speaking? How are you going to elaborate the wheeze? Excuse me. Yep, tell me.
Okay, so what do you mean by this?
Wheeze? Let me tell you something. Wheeze means wheeze.
Oh, okay. So
Like,
they
as,
know this term. You is okay.
yeah, seriously, he will tell you wheeze, or she will tell you wheeze. She knows wheeze very
Okay.
well.
Oh, okay.
Wheeze is actually the layman word. No problem about it.
Oh, all right. Okay. Okay. So, is it is it stays all day long or like episodic at
Dr.
night
Maria,
or in the morning?
I wrote you exactly what are the questions to be asked few
Oh,
seconds ago.
okay. Okay. Has it changed?
So she will
Or
tell you.
since when it started?
Okay, it
And has
started
it changed?
yesterday. Doctor. It started yesterday, and it's getting
Okay.
worse. Do not ask two questions at one time. One question at one time. Okay.
Okay. Okay. And it's getting worse. Okay. And anything else?
Like what, doctor?
Like along with this, has she has any kind of fever?
Yeah. Okay, doctor. She had actually like fever or flu-like illness recently. She
Okay.
has been coughing. She has
When?
been coughing and having flu recently.
For? Okay. For how long?
3 to 5 days, doctor.
Okay, 3 to 5 days. Okay. Has it changed now?
Doctor, it's getting worse.
Okay. And she take any medication or something like that?
No.
Okay. Tell me something about her past medical history. Like how's she doing?
Dr. Maria, I told you many
Yeah.
times, whenever you are asking, ask about the presenting complaint and then ask about associating symptoms.
Oh, okay. Oh,
What
I
could be the
asked about
associating
the
symptoms?
fever and the cough.
What could be else? Dr. Maria, okay, okay, you can, okay, just follow me. Close your mic right now and follow
All
me.
right.
No problem at all, no problem. You're
Oh,
doing a great job.
sorry.
No, it's fine, it's fine. By the way, when is your exam?
Okay. I haven't booked it yet.
Uh-huh.
I
Hello?
haven't booked it yet. I haven't booked my date yet.
Oh, yes, but when are you planning?
My plan is like after November. Like November is my
Yeah,
plan.
because you're doing
Because
internship.
I'm doing my internship.
Yeah,
Yeah, I'm doing my internship. Yeah.
yeah,
I need my
okay.
papers as well.
We still have long time. We still have long time, no problem. I was just about to tell you that you still have to maybe start like reading sometime, but it's fine. You're still having some time. But guess what? If I catch you after July, if I'm still there after July and I catch you not studying,
Yeah.
I don't know what to
Okay,
do.
no problem. You won't catch me. Not starting after July.
Okay, I hope so.
Inshallah.
Okay. So the thing is that actually she told you about the short. You can mute yourself right now. She told you about the shortness of breath and the wheeze and later on, she told you about the cough and the flu. Elaborate each of them. Do not elaborate two complaints at one time. Pick up each complaint. Like, for example, elaborate the wheeze separately. Then elaborate the cough separately. Then elaborate the shortness of breath separately. Please do this. What are the associating symptoms? Now you can ask about the fever. Fever is very important as a first associating symptom. It is the chest infection. Remember from the medicine stations in the very beginning, in the past few days, the past good days, in the very beginning, actually, in the medicine stations, we have to speak about number 1, the cough, number 2, shortness of breath, number 3, fever, number 4, chest pain, number 5, nausea and vomiting are very important. Okay, those are the signs of any chest infection. Please do not miss them. Okay. Okay, so she will give you also fever. I told you, so she give you shortness of breath and fever and cough, and we elaborate each of them. Okay. Any question? When did it start? How did it start? Has it changed? Anything makes it better? Anything makes it worse? For any complaint. Okay. Now move to the past medical history. Previous episodes is very important here. Why? Because the test tells me that she had 2 previous episodes. So she will tell you about 2 previous episodes. Ask about each episode. Do not ask about 2 episodes directly. Ask about each episode, please. For example, let's speak about the first episode. When did it start? Doctor, it started 2 years old. It happened 2 years old when she was 2 years old. And what was done then? Or what did you do? She took her to the hospital and they told her that she had an infection called, guess what, Dr. Maria? What did they tell her when she was 1 year old? When she was 9 months old? Tell her what's hospital.
Bronchiolitis?
Right, perfect. They told her that she's having bronchiolitis. And what was managed? Conservative management. They kept her in the hospital overnight. and they just prescribe for paracetamol because the management of the bronchiolitis is just conservative management and some antipyretic. That's all. Please mark this word. The management of bronchiolitis is always supportive treatment like antipyretics and hospital admission or observation. Okay, and you will know now why, or after a while you will know why hospital admission. Okay, second episode, the same questions. But what happened in second episode? In second episode, they just told her, they gave her oxygen this time, and they prescribed for her a blue inhaler to be taken for a while. So now you know that the second episode happened when she was 5 years old, and she was prescribed some blue inhaler. You know what's a blue inhaler? Simply paracetamol. So here, basically, in this station, they need you to diagnose asthma. We asked about the presenting complaint and the associating symptoms. Still, the differential diagnosis are remaining. What is the differential diagnosis, Dr. Maria? Just think about 2 or 3 differentials. Very enough.
COPD?
Dr. Maria, what are the
No?
differentials for any fever or any infection?
Oh, any fever, chest infection?
Okay, she already has, or she could be having. What are the other diseases?
Could be meningitis.
Okay, very good. Meningitis is one red flag. What else? Dr. Maria, can you hear me? Can everybody hear me here? Hello, guys. Dr. Maria escaped. I think Dr. Maria left. Guys, is my voice is interrupting? My voice is interrupting, guys?
No, I can hear you perfectly.
Because I think my voice is interrupting a little bit.
No,
Hello?
yeah, probably something, Dr. Maria.
Oh.
Excuse me? What, Dr. Rivera? What you said? Yeah, what you said, Dr. Rivera?
I said maybe something with the microphone of Dr. Maria.
Okay, okay.
Yeah, I got disconnected.
Yes, no problem, no problem. Okay, so what are your other differentials?
Oh, I was talking about meningitis and about chest infection, like pneumonia.
Very important, and this is very enough.
Okay.
Thank you so much. Those are the most important differentials to be asked in any fever case. Okay, Dr. Maria? Okay.
Yes.
Okay, so those are your differentials. In the medical conditions, she can give you some history of eczema and hay fever. For eczema, it is managed through some creams, and the hay fever, sometimes it can be managed like by antihistaminics. Hay fever is usually managed by antihistaminics. Eczema is managed only by creams. Okay, does she take any medications? No, actually the past or the other medical history is not significant. Only there is a family history of asthma. So now, guys, I think the one who cannot pick up the diagnosis of the asthma, he never passed through the 7 or 6 years of the medical school. Maybe it happens. Okay, what about the lifestyle? In the personal lifestyle or the social questions, I am going to ask the birthday questions. But please here mark 2 or more important things here in this station to be asked after the birth. After the birth questions, always you have to ask this question: who takes care of the child? But add here that you need to ask about them: is the home carpeted? Is there any carpets in home? Is there any pets at home? Those 2 questions are important because those are triggering for the asthma. Again, carpets and pets. Ask about pets, carpets and pets. Okay, examinations. Which examination differently again respiratory and ENT examination? The only thing is that you can find all examinations are normal. Sometimes some tachypnea. Tachypnea can happen here. Okay, which investigations to do? Sometimes examiner here will tell you which. Okay, Dr. Muiba, tell me which investigations to do here in this case.
We can do the routine bloods.
What else?
And chest X-ray.
No need to do chest X-ray. Believe me.
Okay,
No,
then.
I will tell you why. But just what else?
Spirometry.
Oh, this is a misconception. Thank you for saying this, Dr. Muniba, because actually I need to point something out here. Thank you so much, really.
Okay.
The spirometry, guys, is usually for the COPD. People confuse between the spirometry and the PEFR. It is PEFR, Dr. Maria. You are right, Dr. Maria. It's PEFR. Do not say spirometry unless the COPD is suspected or is confirmed even sometime. So please just say that PEFR, peak expiratory flow rate. Okay, okay. So now what is the management condition called asthma? What is asthma? Very simple. A condition which affects the airway, which makes the airway is tight and inflamed in a way that the air cannot be blown out of the lung. So the airway tight and inflamed. Guys, stop chit-chatting. Tight and inflamed in a way that air cannot be blown out of the lungs. It's fine, Dr. May, it's fine. I'm kidding, I want you to concentrate. Why this happened to him? Very simple. Now, you will pick up from the history. Number 1, bronchiolitis is one reason. Number 2, family history. Number 3, hay fever and eczema. Here, if they asked about why, which means that they need the reason. The reason is always family history, bronchiolitis, and other medical conditions like eczema and hay fever. So this is the reason why. But about the triggering factors, what are the triggering factors which could happen here in this case? The triggering factors are number 1, upper respiratory tract infection recently. Number 2, passive smoking. Number 3, having pits or carpets at home. So again, the thing is that 7 years old Dr. Rivera. Okay, so the triggering factors are upper respiratory tract infection, carpets, and pits. What is the treatment here in this case? Simply, number 1, hospital admission. Why? Because his asthma attack, we need to keep in the hospital. Okay, we will give oxygen, number 1. Number 2, okay, number 2, we will do PEFR and chest X-ray. PEFR and chest X-ray because we need to determine the severity of the asthma here. So PEFR and chest examination, not X-ray. PEFR and chest examination. We don't do chest X-ray here because we know very well that this is asthma. I mean, the asthma is not picked up by chest X-ray. The infections, yes, but the asthma, no. PEFR is a diagnostic for chest X-ray, and usually we do not do chest X-ray like unnecessary in the children. We usually try to minimize it as much as possible. Radiation. So number 1, admission. Number 2, chest examination and PEFR. Number 3, now you can speak. Number 1, admission. Number 2, oxygen. Number 3, chest examination and PEFR. Number 4, speak about the nebulized medication. What are the medications that we are going? What are the examinations that we are the medications that we are going to prescribe? The blue inhaler and the brown inhaler. Very similar to the adult station. Blue inhaler and brown inhaler. The only difference is that we are going to give via spacer. Okay, so again, number 4, nebulized medications, which is the salbutamol and steroids inhaler, the blue and the brown inhaler. But here we're going to give via a spacer. Which spacer? We're going to speak about it tomorrow, inshallah. Okay, okay. And as well, we will discharge him or her with an asthma diary. So, okay, again, let's sum the treatment plan. Number 1, admission. Number 2, chest. Number 2, oxygen. Number 3, chest examination and PEFR to check the severity of the asthma. Number 4, nebulization. Blue and brown. Number 5, send home with diary. Okay. When can I take my baby home? Very simple. When he gets better. I mean, we keep monitoring him until he gets better, and if everything goes smooth, you can take him maybe by the end of the day or tomorrow. What about the school? We'll provide with a sick note, definitely. Warning signs here is that what are the warning signs? Okay, simple. If the inhaler is not controlling the symptoms, or if his lips turn blue, bring him back to the A&E. So if the inhaler is not controlling symptoms, or if his lips turn blue, come back to the A&E. Did you miss anything, guys?
Yeah, Dr. Ahmed.
Yes, sure.
Yeah, just regarding the associated symptoms, the patient presented with shortness of breath, wheeze, and coughing. What are the most important associated symptoms? Because you mentioned the previous scenario, previous case, that you should ask about this fever, sleeping, poor feeding, crying, lethargy. Can we ask those in this Or
you can ask about these symptoms, no problem at all. You can ask about them, but you know, I need to tell you one thing. Shortness of breath and wheeze, usually they are asthma, they are not infection. Okay, so if you want to just rule out, I mean, you can rule out maybe meningitis, one question, because she will tell you that you had like upper respiratory tract infection like few weeks ago. But if you want to rule out something, you can rule meningitis, but do not stress more on signs of infection, because you know now it is not infection, it is just asthma. But in the otitis media, there is fever. The presentation is fever and pulling the ear. So now it is infection from the presentation. In general, you can ask about one or two symptoms from the infection that we get. Yes, but I mean, yeah.
Yeah. So the one I mentioned, those symptoms are sign of infection.
Yeah. You can ask about two of them at least in each station in which you are suspecting infection. You better ask about them actually. Why? Because you are sometimes the only signs of infection, and sometimes you can also need upon them you can need to rule out dehydration, especially in the vomiting or the diarrhea, the frequent diarrhea. So please keep them, ask about them in any pediatric station. Okay.
Okay. Thank you.
Okay. So this station was very easy station as well. Okay. Guys, tell me, did we do the head injury yesterday, right? We did head injury because I was trying to revise it from my notes. Like I was trying to revise if I explained it or not, and I think I did it, but I didn't mark it in my notes. I mean, I didn't mark that we did it. Oh, welcome back, Dr. Yasmin. 1 year, Dr. Hilbert, not 2 years. Bronchiolitis, 1 year, under 1 year age. Okay, very good. Let me recheck our list right now. By the way, you will just need to give me some time for the chlamydia station because still it is not clear. I'm just trying to speak or to talk to someone who took it about the concern of the mother about it. I will post it to you maybe tomorrow or the day after tomorrow in a recording as well. So we will be left definitely with the chlamydia station.
Dr. Ahmed?
Yep.
You know that you owe us quite a few things.
Excuse me?
You owe us quite a few things. And I was
actually the voice is interrupting. I don't know what's wrong. Guys, is my voice interrupting?
Yes.
My voice is interrupting?
Yes, it is interrupting.
Oh, okay. Wait, guys, just give me 1 minute because I think I need to restart my connection because actually I cannot hear anyone from you. Wait, give me 1 minute. I'll be back in 1 minute. Hello, guys. Sorry for the interruption. So, Dr. Evere, I wanted to ask about one thing. What is the thing?
I was going to ask you, because we and Dr. Islam are going first for the exam, the things you said that you post a bit later, I don't remember. There was quite a few things. You said just the little notes.
No, wait. I need to post three things exactly. Number one, the remaining recording of the third session. You remember when my connection was very bad? This is number one. Number two, I'm going to send you like a summary to the ethical notes. To
Yes,
be revised.
please. Yeah.
Summary to ethical notes, and I need also to send you a recording to the chlamydia station and the hyperparathyroidism and the multiple myeloma.
Yes. Yeah. Yes, please. Yeah.
Okay.
I would be grateful. Yeah.
Don't
Thanks.
worry, your exam is still like maybe in more than 3 weeks or 3 weeks exactly, which means that you can
exactly 3 weeks. 3 weeks from now, I'll be sitting and trembling there. Probably I will be done by now.
Yeah, it will be done, inshallah, and you will be done forever with it. So
thank you.
The thing that the ethics station will barely take you maybe 1 or 2 hours to read or to revise. And the remaining stations, I mean, even if new stations come, I always do my best to catch them, and summarize them. This is what I do.
Thank you. Thank you.
So, has anyone got any questions so far? Any further question? Okay. Give me 1 minute, guys. Sorry, I'm sorry. Okay, so cystic fibrosis in the diagnosis of what, Dr. Muniba? In the diagnosis of asthma?
No, I mean with the same symptoms, like in that even the patient presents shortness.
Frequent infections.
And yes, frequent infections, frequent ammonia episodes.
I'm not sure actually. I'm not sure, but you know, it was a high yield question in PLAB 1.
Yes, yes, I know that.
Yeah, it was very common in PLAB 1, but I'm not sure in PLAB 2, because what can you do in PLAB 2? You can definitely refer to specialists for further enzymatic assays and tests.
Yeah, right. Okay, thank you.
My friend got it and she failed even though she checked the technique. No, this is not the one, Dr. Yasmin. This is not the one. The other one is spacer technique. You know why she failed? I guess she failed because she picked up the wrong spacer. Because you'll be putting many colors like blue and yellow. And sometimes I told you one time before that in any spacer or any mouth device, you should always change the mouthpiece. I mean, do not place your mouth and then ask the patient to demonstrate on the same spot. Okay? So always mind the hygiene thing. They look for.
Oh, Dr. Ahmed, this situation was that mom was using from very first the blue one, because she brought that and she told that okay, no one told me to use the yellow one. Should I use? So she was using blue one. So that was one mistake counted, like okay, so mother was not using the proper one. Child was 4 years old, I believe. So then she corrected it that no, like, do you know why this is not appropriate for your son? You know, like then she said, no, no one told me about this. Can you tell me what's the advantage of using yellow one then? Okay, then about the technique, she asked, okay, could you please show me how you are using that? Then she made one mistake more, that by saying that, okay, you know, like I just give in a hurry, you know, like my child is to be crying and in rush, so I just put in front of the mouth, and then within fraction of second, I just took it away. So that was also corrected by my Dr. Fan. I'm talking about Dr. Naisi, by the way. Ahmad, you know him.
Oh yeah, sure.
Yeah. So she discussed me like, what's the reason might be that I failed that station. I found the mistake that mother was using the wrong spacer, that is the adult one. Number two, the technique of keeping the spacer in front of the mouth and for how many minutes, it was wrong. So I corrected, I guided accordingly. Even then, why I failed the station. That's why I was waiting for going through this station also.
No, you will definitely go through it tomorrow because it's a combined station. I mean, each device. But just one thing, I told you that sometimes, did she explain to the mother on the yellow spacer?
Yes.
I mean, she picked up the yellow spacer from the table?
Yeah. It was not expected, but she said that, look, this is the difference. What's the difference? The mask size.
Did she take proper history?
Yeah, she took it. She took, because it was uncontrolled asthma, and mother was worried that why I'm not sure that multiple times he needs to admit in the hospital. This is not first time I'm coming for that readmission. I'm just diagnosis as something other than asthma. That's why I'm just wondering, is it provoking towards the cystic fibrosis then? That's why I'm wondering.
No. It has no relation. This patient always comes as asthma. It's uncontrolled asthma. It has no relation with it. The problem is
Doctor.
Yeah.
Dr. Ahmed, you know, here the kids are very rigorously monitored with the cystic fibrosis. It wouldn't be the first presentation at 5 years old.
Yeah, sure.
They do this first. I think the pre-test. They take blood still in a hospital, and they give you a call within the first 6 weeks if the child has a cystic fibrosis. And after that, there is no chance of child coming to the hospital with the first presentation of cystic fibrosis at 5 years old.
Yeah.
So we can I think safely raise the cystic fibrosis from DGs here. I'm not sure.
From what?
For the cystic fibrosis, Dr. Elvira, there would be some other issues with the growth chart and frequent diarrhea episodes also. Not only the lung infections, but also with the diarrhea and low growth chart.
Yes, correct. Yeah.
Those things will be associated with those things. But
That's
here,
correct,
I don't know. Maybe.
Yes, Dr. Zaid, you should know the size of the spacers. We'll speak about them tomorrow, but usually you will pick up the yellow one if the age is above 4, is above 2. Okay, so let's move to the next station, which is the neonatal Jones. In the neonatal Jones, the tasks say that you're FY2 working in pediatric. The boy is David, or the patient is David, 15 years old baby. He has been brought to the hospital by his mother, Mrs. Janet, and he has been referred by midwife. So they have been referred by the midwife. Why did they have been referred? Because the midwife noticed that the baby has jaundice of the eyes and is clear. So the midwife wants you to see the patient. The weight of the baby, the birth weight was 3.5. The current weight is 3.7. What you must do, talk to the mother and address her concern. Special note, your nurse colleague is looking after the baby in the next room. So now what you will do, the mother is worried. Where's my baby? Is he okay? Again, he's in the next room. My nurse colleague is looking after him. Okay, I need to ask you a few questions. Which question? Doctor, what, again, reason of visit, number 1. What brought you to the hospital today? She will tell you the whole story that the midwife noticed some yellow discoloration and the thing. Okay, she will tell you that she noticed his skin or his eye or his eyes and skin are yellow in color. So have you noticed this as well? She will tell you, yes, doctor, I noticed that maybe when the midwife told me only. So she didn't notice it before. She noticed it only after the midwife said, right? Okay, thank you. So now I'm going to ask you a few symptoms or few questions which can be related to his symptom or his problem. What questions, doctor? Does he have any symptoms? Like what? You know, now I have to ask about symptoms of the jaundice. What are symptoms? Number one, discoloration in the poo or the wee, right? Number two. So number one, the discoloration in the poo or the wee. What is number two as well? I have to ask about signs of jaundice. Signs of jaundice are very similar to the signs of infection. So I asked about discoloration, number one. Number two, any fever or flu-like symptoms. Number three, is he playful like before? Number four, is he crying? Okay. Number five, poor feeding. So sleepy or floppy, poor feeding, crying, and change in the color. These are signs of infection, and they are similar to signs of jaundice as well here. So sometimes she can tell you, doctor, he is feeling well as usual. So the feeding has no problem when I ask about poor feeding. For example, you'll ask her, what do you feed him or what do you give him? Why? Because the feeding is very important in the neonatal jaundice. So may I know what do you feed him? Doctor, I just breastfeed him. What are you feeding him? Breastfeeding, okay? Okay. Now here, you have to be very specific in the feeding. Why? Because the feeding is a precipitating factor to the neonatal jaundice. She told you that she breastfeed him how many times per day? 4 to 5 times. Any recent change in the feeding or in the feeding habits? No. Okay. So now ask about the birth questions or ask about the past medical history. What is the past medical history before the birth questions? You can ask about infection in the recent health. Okay. And rash. Any infection or rash. Why? Because actually some viral infections can cause this problem. So infection or rash, just infection is very enough. Okay. Any medical condition? No. Any medications, any family history? Very important here to ask about any family history. Why? Because actually the risk is increasing if the mother is having maybe diabetes during pregnancy, any liver disease during pregnancy or in the family, any thyroid problem in the pregnancy or the family. So again, family history is very important. I have to ask about any family history of diabetes, any family history of thyroid problem, any family history of liver problem. Why? Because if these problems are found in the mother, they can increase the chance of the baby having neonatal jaundice. I need also to ask the mother in the end of the history one very good question. Does your blood group differ from the blood group of your little one? Why? Because this is blood group incompatibility. Blood group incompatibility. So does your blood group differ from the little one blood type or blood group? No. Okay, so now I asked about the past medical history, which is very conclusive for the fever and the other medical conditions and the family history. The fever, very important. Family history is very important, including diabetes, liver problem, hypothyroidism or thyroid problem, and blood grouping or RH incompatibility. Birthday questions as well are important. Okay, in the birthday questions, I have to ask about. Okay, I asked about the feeding before, right? I asked about the feeding in the presenting complaint. Now I need to ask about the birth. You know, prematurity is one risk factor for jaundice. So I have to ask about how was his birth, how many weeks your child was born. She will tell you full term. So he was not premature. Was there any complications? No. What about his birth weight? Is mentioned in the task 3.5. Okay, okay. Now you asked about the red book. You can ask about the red book. You can also ask about the diet or feeding, which you already asked about. So birth questions are very important. Just mark the birth. Why? Because they need to exclude prematurity. Now do examinations. Which examinations, guys? The most important here is abdominal examination. Besides, of course, vitals and general physical. This is definite. The examiner will tell you, doctor, the findings are similar to your task. Sometimes he can ask you, doctor, what are you looking for abdominal examination? I mean, why abdominal examination? You know why we are doing the abdominal examination? Because we need to see the signs of the liver failure or any liver problems or any associated joints. What are the signs of any associated joints, guys? Number one, mass or hepatosplenomegaly. Number two, mass in the abdomen. Number three, any skin changes or skin discoloration. So any mass or any skin discoloration. Those are found in the tummy usually in cases of joints due to associated liver problems. I'd like to do some investigations. Please, I need all of you to mark the investigations here because this is the core of the station. This is one of the very rare stations in which the core is the investigations. Why? Because the examiner will ask you which investigation, and you have to be very good in the investigation here or very specific. Which investigation? Number one, I need to check the bilirubin level in the blood. Number two, routine blood test. Number three, antibodies. Auto antibodies. Number four, infection screening. Number five, any enzymatic deficiency, G6PD. Okay, so again, number one, routine blood test. Number two, bilirubin level. Number three, antibody. Why antibody? For the RH incompatibility. Number four, infection screening to exclude any infection, especially the rubella. Number five, any enzymatic deficiency, especially G6PD. The examiner will give you finding. He will tell you, doctor, the total bilirubin in the blood is raised, but below the treatment level. What does this word mean, Dr. Bina? What do I mean by below the treatment level? Number five is any enzymatic deficiency.
Means we do not need to give any treatment, just symptomatic treatment is required.
Exactly, Dr. Bina. We do not need to give any treatment, right?
Yes.
Okay. Other investigations are normal. So what is wrong, doctor? What's wrong with my baby? We are going to disclose a condition called neonatal jaundice. You know what was the age of the baby here? He was 15 days old. 15 days old, and you know what? The neonatal jaundice always lasts for 14 days only. So you're going to tell her that it's called neonatal jaundice. But when it lasts for more than 14 days, and full term baby, because he was term, we call it prolonged jaundice. So prolonged jaundice when the neonatal jaundice stays for more than 14 days. Okay, doctor, why did he become yellow all over? Now you can explain the theory to him by simply jaundice is due to the accumulation of substance called bilirubin. What is the bilirubin? It is a substance or some color substance which is result from the breakdown of the RBCs, red blood cells. When the red blood cells are broken in the bloodstream, they produce the bilirubin, which is supposed to be conjugated or excreted in the liver. Conjugated in the liver, but due to some problems in the liver, sometimes this amount of the bilirubin is not excreted or not conjugated properly. That's why it accumulates in the blood and it causes the discoloration. So when there is any problem with the liver, okay, it happens all that the liver is not able to excrete it. Why it happens in the children? No, it's not about the liver in the children. I will tell you something. In the children, simply, number one, the liver is immature enough. I mean, it's not mature enough to conjugate all the number of the bilirubin. So it will end up as some bilirubin not excreted. Number two, the RBCs. The number of the RBCs is higher, which means that higher bilirubin. So for two reasons, number of RBCs and the liver efficiency as well. Okay, she will ask you, doctor, shall I continue breastfeeding my baby? You will tell her that there is no need to stop the breastfeeding here. Why? Because usually the symptoms are self-limiting. So the breastfeeding benefits outweigh the disadvantages. Okay, is there anything wrong with my feeding, doctor? You reassure her that nothing is wrong. However, you know there is a link between both things. Why? Because it's believed that the breastfeeding sometimes the breastfeeding, some theories are based that the breastfeeding contains substance that reduce the ability of liver to process bilirubin. Again, breastfeeding contains substance that may impair or may affect the ability of liver to excrete or to process the bilirubin, and that's why it's linked sometimes to the neonatal jaundice. What are you going to do now? Number 1, keep in hospital. Number 2, senior review. Number 3, investigations. Which investigations? The investigations that we mentioned a while ago. All of them. Okay, doctor, aren't you going to give any treatment? Simply, in this case, you will tell her that the bilirubin level was below the treatment line or the treatment level, so he doesn't need any treatment. Usually, it settles within a few weeks. So he doesn't need any treatment and it settles in a few weeks. What are the warning signs? You will tell her that she needs to have a look or a closer look at her little one at home when she's sent home. If there is any change in his activity, like if he becomes floppy, if he becomes more tired, if he cries too much or excessively, if he eats poorly, and if he develops any discoloration on his skin or his discoloration is not disappeared, then you will tell her all the signs of the jaundice. If it did happen, okay, please come back to us. This is one thing. Number 2, breastfeed him regularly. Continue breastfeeding him. Do not stop breastfeeding. Doctor, is it dangerous? Okay, in this case, actually, you will tell her that it's very common and usually it resolves on its own. However, as I told you, to make sure that everything is fine, we're going to do this test to confirm it. This is the station. So the station is basically about reassurance and that it's self-limiting and the bilirubin is below the treatment level. We're going to keep him in the hospital to do these investigations, all investigations that we said, and to keep a closer look at him. DDs here are very simply infection, rubella, hypothyroidism. You can also ask about maybe diabetes in the mother. So I told you that you can ask simply, have you been diagnosed with any thyroid problem? What about any diabetes problem? What about any liver problem? Infection as well. So infection like rubella, like any enzymatic deficiency, you can ask about liver and thyroid problem as well. So again, DDs are infection. Number 2, liver problem. That's why, remember, in the examination, I told you that you're doing tummy examination to see if there's any mass or any hepatosplenomegaly. Liver problem, thyroid problem, especially hypothyroidism. This is number 3. Number 4, any diabetes.
Dr. Ahmed?
Yes.
Yeah, just regarding the how to elaborate the jaundice of your discussion. The same question, since when it's getting better, or
yeah,
the same?
Since when it started. No, actually, she told you that she did not notice it, except after the midwife words. So when you ask her, when did you notice it? She will tell you, doctor, I just noticed it like a while ago, after the midwife told me, like a few hours ago, or a few minutes ago. So it's not possible to ask her about the progression, because she just noticed it. She noticed it right now. If you notice something since 5 minutes, would I ask you, doctor, has it changed? No, I don't know.
Okay.
She'll tell you, doctor, I don't know, I just noticed it.
Yeah.
So, but generally, for any complaint, I told you, when did it start? How did it start? Has it changed? Like it. And anything makes it better, anything makes it worse? Okay, one more interesting station as well, which is the bronchiolitis. You know, the bronchiolitis station is a very easy station. Why? You just only need to know one thing. You need to know that he is 4 or 5 months old. Why you need break? Why you need break, Dr. Rivera? Because it just came Like right now, it came like 6:30. You can take the 5 minutes break, no problem. We'll just have a quick summary when you come back. No problem, take your time. Okay, so here, you know, the task tells you that the child has been examined in the hospital, and you can find the vitals. In the vitals, you can find marked tachycardia, marked fever as well, it can be up to 39 degrees, marked tachypnea, and low oxygen saturation here. All these vitals will point you toward something respiratory. Clearly, this is definitely something respiratory. You know now from the vitals that the patient is having very bad infection and most probably respiratory infection due to the low oxygen saturation. Okay, the mother is really worried about the baby. Keep reassuring her. May I know what brought you to the hospital? She will tell you the full story. But here the presentation, can anyone guess of the presentation or can anyone think about the presentation? What could be the presentation in the bronchiolitis? What is the main presentation in the bronchiolitis? Can anyone guess? I need someone to collaborate it with me. Come. Anyone can help?
It could be poor feeding.
Oh, mashallah. Someone is very bright today. Someone is very clever today. Yes, Dr. Muniba, you are right. Poor feeding. But guess what? You know, this can change at any time. They can bring it to you as shortness of breath. You know why, Dr. Muniba?
Yes.
Because they need to confuse you between it and between the asthma.
Okay.
But what is the difference between the asthma and the bronchiolitis, Dr. Muniba?
What was the age?
Exactly. And you see here there is also fever. Most probably it is itis. Itis means infection.
Infection or inflammation.
So now you know that there are two differences, the age and there is infection or fever here. Please always keep this in your mind. Okay.
Right.
Dr. Yasmin, you are a pediatrician by nature here. You are our consultant here, our senior here. Okay. So the thing is that doctor, you know the presenting complaint is Dr. Ahmed kids usually come to the hospital quite poorly. Like how quite poorly?
I mean, they are usually in a very poor state. Because they are quite often dehydrated because they couldn't. They are all bunged up, the noses. They can't feed. They can't breathe. They breathe on this very heavy breathing, and kids are quite poorly, especially the first few days. So that's very clear presentation of a bronchiolitis.
Yeah, very common.
It's very, very common here in the UK. Very common. Almost every other child, especially in the very first year, first 6 months.
I think it's common in anyone. I mean, in
is
any
it?
country,
I don't know.
Yeah, because in my country as well, it's common. Like it usually comes with bronchiolitis in the first year. Why? You know, in UK, I understand it's due to the weather conditions, but here it's due to sometimes like improper care, like this. So usually they end up having bronchiolitis, especially in the people who are going to have asthma later or having family history of respiratory problems.
Yeah, I used to say that the
you know,
uncaring mother, but it's not very nice to say.
No, it's fine. There is full of bugs. Yeah. It's full of bugs everywhere, Dr. Muira, in Egypt, in Pakistan, in everywhere, in Bangladesh as well, Dr. Maria. So here the main presentation is poor feeding. How can I elaborate it? You know, to elaborate the poor feeding is very simple. When did it start? How did it start? Has it changed? It started 2 or 3 days ago and it's getting worse. Okay, I can ask you one question. How did you know that he's feeding poorly? She will tell you, doctor, you know, I used to give him formula milk. He used to drink many numbers or many feeds per day. But now he's only taking one of them or barely 2 of them. Or sometimes he can't take milk at all. So she will show you that he is feeling less than he should. Okay, ask her one question. Guys, when there is any poor feeling, we need to ask one important question. Did you change the formula or did you change the feeding recently? She will tell you, yes, doctor, I changed the feeding recently. I was breastfeeding him, but last month I changed it to formula milk. So she changed the formula recently. Actually, guys, this can be one risk factor to the lower immunity. Changing the feedings, not all of them can tolerate it all the time. Changing the feeding sometimes can mess up with the immunity of the baby. The baby is not feeding well. He doesn't like it, so he is getting more poor immunity because of poor feeding, and this low immunity can cause to bronchiolitis. Okay, so now I've got poor feeding. From the task there is tachypnea and there is fever and there is tachycardia as well. What is the associating symptom here, Dr. Muniba, beside the poor feeding? Those that are given that that the vitals are showing what I told you, Dr. Muniba. Tell me.
Apart from the vitals, yes, patient would be
not
playful like before.
No, I asked you about the associating symptoms, even given the vitals. For example, you only asked about poor feeding. What could be the other associating symptoms? I mean, pick them up from the vitals. From the vitals that he's having fever.
The patient can have shortness of breath.
Okay, very good. How can you avoid shortness of breath?
When did it start? Has it changed?
When did it start? How did it start? Has it changed? Anything makes it better? Anything
better or worse? Yeah.
Okay. Dr. Muniba, from the task as well that there is fever in the vitals.
Yes. We would ask about the fever. When did it start? How did it start? Has it changed? Did you give anything for the temperature?
Okay, very good. Okay, so this child is having fever. Okay, she will tell you that she was very hot. It started 3 days ago. Okay, and it gets worse. And I gave him Calpol, but it didn't help him.
Right. Then we ask anything else apart from this.
Like what, doctor?
Then we would move to the rolling out the DDs.
Like what?
We can ask, has he developed any fits, any rash?
Okay, signs of meningitis. What else?
Yeah, exactly, signs of meningitis. And any problem in the poo? Any problem in B?
Okay. One important thing here is that when you ask her about shortness of breath, she'll tell you, yes, doctor. He was struggling to take his breath. Doctor, she will try to show you that.
Has you noticed that his? Yes.
She will try to show you that he's drawing his lips and his ribs inside.
Your voice is breaking.
Yeah. No. She will try to show you that he will be drawing his ribs inside. Like struggling to take breath.
Oh, hello? Yes, intercostal recessions.
Yeah, exactly. So now you got that number 1 is poor feeding, number 2 fever. You ruled out the DDs of the fever. Number 3, shortness of breath. She will show you the shortness of breath, right?
Yes.
Okay. What else to be asked apart from fever and shortness of breath? Cough. Hello.
Yes. Cough.
Can you hear me?
Yes. Hello. Cough.
Okay. So
yes, your voice was interrupting.
Yes, you have to ask about cough, right?
Yes.
Okay, Dr. Muniba, you can ask also about 2 symptoms of the infection. I asked about fever, shortness of breath, and cough with the DDs of the fever as well, because I need to rule out infections. Now I can ask about the symptoms of the infection, like what? Poor feeding, I asked about it, like maybe crying and maybe sleepiness or floppiness. Okay?
Yes.
And now move to the past medical history. What is the past medical history here? Very important.
Any previous episodes?
Okay, no previous episodes. Now move to the birthday
recent
question.
Health?
No, okay, move to the birthday question.
How was his birth?
Absolutely fine. Vaginal delivery.
Was it at term? Was it full term?
Oh, this is a very good question, Dr. Muniba. Thank you so much. Why I asked you this question, Dr. Muniba?
Because premature babies doesn't have a proper, the lung functions are not very proper.
Very good. Thank you. This is the core of the station. She will tell you that, doctor, yes, he was born premature. May I know why? Doctor,
Okay.
there was no problem. I just had the labor earlier. See who is put for the hospital in the hospital for 1 week under observation in the NICU. The NICU, neonatal intensive care unit. So now you know that there are two reasons for poor immunity. Number one, poor feeding, which can also be a sign of infection. So number one, poor feeding. Number two, prematurity. Okay. Ask about the jabs. Ask about the red book. Okay.
Yes.
Ask about maybe the we and the poo, which you asked about. What are the other questions I ask when there's any respiratory complaint? Like any upper respiratory tract infection, what are the precipitating factors? Yeah, family history is number one. I asked about it in the past medical history before the birth. I need to ask a specific set of questions to Muniba. Smoking in the
For
house.
upper respiratory.
Smoking.
Smoking, yeah, passive
Cats.
smoking. And
Yes.
birds and loose carpets.
Yes,
Sorry,
exactly.
carpets. Sorry.
Yes, because why? Because this is any respiratory infection. Any respiratory infection, I need to ask this question. The home condition. Those are precipitating to any respiratory infection. Okay, now she can ask you at any point, doctor, I want him to have antibiotics, doctor. What are you going to say? Even while you are taking history. You simply tell her that.
Well, we will first disclose the diagnosis. Yes, yes.
You can simply tell her that I understand, but just let me ask you a few questions, and if the antibiotics are necessary, I'm going to prescribe it, even during your history, if she asks you this question. Okay, which examination to do here, Dr. Muniba?
We would do vitals again, the chest examination.
And what else?
As well. And we can also do the ENT examination, I guess.
Exactly. Any respiratory, listen guys, any respiratory station, you have, or any infection, you have to do ENT and respiratory examination, both of them. Okay, the examiner will give you the vitals as in the task, and they will tell you many other findings, like what? The baby is lethargic. And in respiratory examination, there is a recession in the chest. Recession means internal draw or in-draw of the chest. On the auscultation, there is bilateral wheeze and crepitations. Okay? Sometimes on the ENT examination, the tympanic membrane is not visible due to wax accumulation. Okay? Okay. So, I'd like to do some investigations. The examiner keeps quiet. Now move to the management. He is having a condition we call bronchiolitis, right, Dr. Muniba?
Yes.
What is bronchiolitis, Dr. Muniba?
It's basically the lungs. Our windpipe, it divides into small tubes, and sometimes there is infection or inflammation going on these tubes. That's why the air cannot go in and out easily, and the child develops these symptoms.
Okay. I have a very simple explanation, Dr. Muniba. Bronchiolitis means inflammation of the bronchioles, which are the terminal part of the airway. How? The airway divides into bronchi. The trachea, which is a windpipe, divides into bronchi, and then the bronchi divides into bronchioles. When these bronchioles are inflamed, we call it bronchiolitis. And usually it's caused by viral infection. You know what is the meaning of the virus here, Dr. Muniba? What is the naming of the virus?
Which we are not going to give the. Sorry?
You know what is the name of the virus here?
Sorry, I can't remember.
Oh, respiratory syncytial virus.
RSV, I guess. RSV.
RSV, exactly.
Syncytial virus. Okay, yeah.
Exactly. What are you going to do, doctor? Are you going to give antibiotics? Can you expect or can you think of the management plan?
But we would keep the child in the hospital.
Exactly.
We would involve the senior. We would give him oxygen and correct his vitals. We will give him antipyretics, IV fluids, and we will keep the child under observation for a while until he gets better.
Very good. So, doctor, I didn't expect you to admit him, doctor. I just wanted to give antibiotics and send us home. She is reluctant for the hospital admission.
Sorry?
She is reluctant. She is against admission.
Then we would ask, why does she want to go home?
Exactly. You know what? She is not aware about the condition. So, you know why you are keeping him in the hospital, Dr. Muniba? Can you tell me why?
Because his saturation is low and he's difficulty breathing. That's why we need to monitor him.
Actually, all this can be managed in 1 hour. But why you are going to keep him in the hospital? Basically, here's the cause of the hospital admission. No, the cause of hospital admission is poor feeding. Poor feeding, we need fluids.
Okay.
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 And sometimes as well, the breathing can need like they can need assisted ventilation. Okay. So here basically the treatment is supportive. Supportive how? Number one, we are going to feed him. How we're going to feed him? Sorry, we can do IV fluids, but preferably we prefer the nasogastric tube. He has not been feeding for 2 or 3 days at least. So this is number one. So nasogastric tube. Number two, oxygen. And we may need assisted ventilation as well if there is no response to the oxygen. Number three, okay, we are going to monitor him. Okay, but why? Because there's a chance of developing complications. Okay, what about antibiotics? What are the reasons we always say about the antibiotics, Dr. Muniba?
Sorry, can you repeat the question again?
Why always, how we justify ourselves that we are not going to give antibiotics? How to explain this?
Well, number one, this bronchiolitis is mainly because of a viral infection, and antibiotics are against some bacteria. So they won't work against these viral infections.
Perfect. And the prescribing antibiotics, yes. What else? Tell me.
It can be the child can develop resistance for these antibiotics.
Exactly.
And third, if later on, if the child, again for the explanation of resistance, if the child later on needs those antibiotics, it won't work.
Yes. Okay, doctor, is there any possibility that my baby develops bacterial infection? What you're going to say? You know, this condition is self-limiting. However, the treatment is very supportive, and we need to follow him or need to observe him until the immunity clears infection. So if the symptoms persist or if the symptoms get worse, this means that there's a chance of bacterial overinfection, and we may need to prescribe antibiotics. So definitely it's self-limiting. It started easing off or going off within a few days, okay? But if it doesn't improve or if there's any complications, okay, like maybe shine through the light, like maybe ear discharge, we definitely can give him antibiotics. Okay, Dr. Mujiba?
Okay.
Okay. Any question, Dr. Mujiba? I didn't know.
No, thank you so much.
Okay. So, has anyone got any question here? Okay, one interesting station. I will not discuss it. It's just, you know, like something like quiz, but it comes. It's just a phone call, and it is an easy station, a very easy one. Doctor, anyone who can elaborate it, it's very simple. I'm not going to practice it even. I'm just going to have a quick chat about Dr. Maria. Dr. Maria, you did not answer in the past station. Now it's your turn to answer.
Hello.
Hello, Dr. Maria. Welcome back.
Okay.
Okay, Dr. Maria, tell me, you are talking on phone to a mother, and she's telling you that the baby is feeling very feverish. The baby is very feverish. What are you going to ask her here?
Okay. Since when this fever has developed?
Tell me more about the fever.
Okay, tell me more about the fever.
Okay, Dr. Maria, if you are not willing, if you are not feeling well to cooperate now, just tell me. It's fine. Take rest and listen only.
Okay.
Okay.
I think I'll listen only.
Okay, no problem, no problem. So,
Sorry
Dr.
about that.
No. No need to be sorry. You are still having 6 months. It's even inhumane. Just use this much. I just need you I need you to be concentrating. Who else? Yes, Dr. Murad, how are you? Dr. Murad, we do not want to waste time too much now. Okay, Dr. Manisha.
Hello.
Yeah, hello, Dr. Manisha. Dr. Manisha told me, she's telling you that the baby has got fever since 2 or 3 days on phone. You'll elaborate, suppose you are elaborating the fever and the fever started 2 or 3 days ago and it's getting worse and she tried paracetamol but it didn't help.
Sorry, interrupting.
Okay, did you listen to me or not? Hello? Hello?
I heard the voice is interrupting sometimes.
Okay. So suppose that the infection or the fever started 2 or 3 days ago and it has been getting worse, okay? And she has tried to give him paracetamol, but it didn't help. Okay. Now, which question to ask about? What to ask after the fever?
Okay. Anything else?
Like what, doctor?
Okay. Did he had any cough?
Yes, he had cough.
And since when?
So she will tell you that cough together with some shortness of breath, and they started 2 days ago together with the fever. What are your differentials here? What are the associating symptoms? What are the associating symptoms first?
Okay. So all the infections like pneumonia and meningitis will ask for rash. All those things and
Associating
UTI.
symptoms, Dr. Manisha. Associating symptoms. You found cough. What are the associating symptoms to cough and fever?
Okay. Any shortness of breath?
Very good.
And the child is pulling ear or not?
Dr. Manisha, associating symptoms to that chest infection. Dr. Manisha. Again, shortness of breath could be chest pain.
But it's a child, baby, right? So how to ask about pain?
Okay, very good. Just any chest tightness or any chest pain, just ask this.
Okay.
Okay. So, Dr. Manisha, okay, now those are the associating symptoms. What are the differentials here?
So the differentials could be bronchiolitis, pneumonia.
No, wait. He is 1 year or two, he's 1 year old, 2 years old.
2 years old. Okay, I'm sorry.
And you ask it about the respiratory infection. What are the DDs or what are the red flags to the respiratory infection?
It could be okay. So it can progress into a shock, like if the baby is feeding well, dehydration.
Exactly. Okay, you can say dehydration. Quiet. Just be calm. Do not stress yourself. You know what are the red flags always to any infection?
Meningitis, like
yeah, number
other
one,
infections.
Yes, meningitis, very important. What else?
What else? Any, oh no.
Okay, very
else?
simple. Okay, Dr. Manisha. Okay, just let me speak. No problem at all. No problem.
Sorry.
No, it's fine. Just do not stress yourself out. Very simple. Respiratory infection. I will ask about the presenting complaint. Number two, associating symptoms. Number three, the red flags and the DDs. What are the red flags here? Number one, meningitis. Number two, very simple, the other causes of infection, like what? UTI, like GIT, like otitis media. Those are the three common infections or the three common causes of fever in that child. I need to ask about these three things to find out the root of the problem. So I ruled out meningitis and I ruled out other infections. Past medical history, not very important here, but you can find upper respiratory tract infection which happened maybe 1 or 2 weeks ago. Again, family history, you can ask about it. Birthday questions as well. Move to the examination. The examiner will tell you the child is not here right now. So now you will tell her that he is having, I suspect that he is having chest infection on the phone call. So doctor, can I give him anything right now or can I give him any antibiotic right now, doctor? Actually, at this moment, we need to bring him here to examine him, and after that, we will decide on the best possible treatment because we may need to put him on oxygen and give him medications. Oh, doctor, what can I do for him right now? Okay, right now you need to send her an ambulance. You know why? Because this is sort of emergency and she cannot bring him to the hospital. Children are usually emergency. Okay, and the fever is high grade and it's there for 2 days and it's not improving. So I need to catch him before developing any fits or developing any meningitis. So you will bring him here to examine, to reassess. You will keep him in the hospital and as senior review, and we may consider giving him oxygen and antibiotics and something for the fever. What are the warning signs? If someone tells me the warning signs here, I will be very thankful to them. Seriously, uploads in advance to the one who's going to tell me the warning signs.
Here we have to give a warning signs of meningitis if he will develop no. 1 sec.
What is the most
if the fever
acute
is
thing?
very
What is the
very
most
high
acute thing?
fever?
What it's high fever. It's high grade fever. High grade fever.
Fits.
Exactly. Thank you. Thank you so much. Thank you so much. The warning signs are okay. You can speak about the meningitis. You can speak about anything, but you will send the ambulance right now. So simply, and you know that there is no rash started and something like this. You are going to send the ambulance right now. But in case he develops fits, what she should do? Tell me, Dr. Rivera, what she should do in case if a child develops fits.
First of all, not to panic. Put the child in a recovery position and
Exactly.
then don't put anything in his mouth.
Yes.
Call ambulance straight away.
Yes, similar signs of epilepsy, exactly.
Undress the child. No, yeah,
and
all that stuff. No, you don't undress. Just leave him on his and call the ambulance straight away, and yourself don't panic and don't try to revive him over.
Exactly. Thank you.
Help
Dr.
is coming.
Huh?
Help is coming.
Yes, help is coming exactly in a few minutes. So this is a whole station. So this is just a quiz. Here you have to ask open question, after elaborating the fever. Sometimes she can tell you and sometimes she cannot tell you. What are the causes of infection or the cause of fever generally in a child? Here you have to know that the three common causes are UTI, respiratory tract infection, and otitis media, and definitely meningitis. So you have to rule out all these things. Very simple one. Any phone call, guys, is an EC station. They bring it for a reason. They need you to pass it.
So I was told it's easier to start from the top to down. For example, start from the meningitis, from head. That would be meningitis, and after would be otitis, and you go a bit down, and it will go to the UTI and upper respiratory, and after go to gastroenteritis or UTI.
Exactly. You can start this
just
way,
acute presentations of them. Yeah.
Exactly. So you can.
I might be wrong.
No. Actually, that's right. Because you can.
But easier.
You can do it this way, and even the elder as well. But I told you that there are only three causes in any case. Like for example, otitis media, chest infection, and UTI. What is the red flag? Meningitis. Those are the four causes of infection, and you can also add GIT as well, no problem. But I mean the cause of infection in elder and in child, I have to ask about them for the cases of confusion and fall in elder, and for the cases of pediatrics, especially the fever. Those are the most important things. One question for each differential. I mean, just do not spend too much time on each differential. Just one question for each. And what are the associated symptoms of any infection, Dr. Elvira?
So would you repeat, please?
What
did
are
you
the
say?
associating symptoms to any infection?
For any infection?
You are checking your
The
notes?
fever? Yeah, no, it's for any infection. You mean all over the body? There would be a fever. You asked me exactly the same question half an hour ago, did you?
Yeah. No. What are the associating symptoms to any infection?
Fever.
Yeah.
Fever, the
Yeah.
first of all.
Yeah.
And depending on the age of a child, there would be different. Is he playful, or he's floppy, or he's active,
Exactly. Those
or
are
is he
signs of
feeding
any
well, or is he pooing? Yeah.
Those are signs of any infection. Okay.
Yes.
Okay. By the way, guys, one important thing is that as well in the pediatrics, there's always a chance if you miss a differential. Why? Because, for example, if you miss the UTI or the GIT, when you come to the birds questions, you will ask about the diet and you will ask about the poo and the wee. And if there is any change in the urine or if there is any change in the stool, she will tell you in this section. So now you will rule out UTI and GIT infection automatically. But the most important thing not to miss is the otitis media and pneumonia and meningitis in the DDs. Okay. This is the station of the phone call, and it came maybe in November. Okay. What else? Here in this section, we are still left with the flu vaccine station. I don't know why many people fear this station. Why? Because actually the patient is really, she's annoying. She'll ask like I'm not kidding, but sometimes she's not in mood, sometimes she's in mood to ask you. It depends. She can ask you some weird questions. She will keep repeating the same question actually. So doctor, it will not cause infection. So doctor, it will not cause an infection. So let's see right now how it works. Usually here again, like the MMR, remember the baby is due to the flu vaccine or the child is due to the flu vaccine. That's why the mother is having some concerns. Okay. So here, what is the main concern? She doesn't want the child to receive the vaccine. Okay. Why she doesn't want him? Because she doesn't want him to catch flu after the flu jab. Will he be sick? Will he catch flu? I will tell you how it can be sometimes, obviously. Doctor, will he catch flu? Will he catch flu? May I know why you think so? Because she has a friend, whose son or his daughter had severe flu after having the vaccine. You will simply here explain to her that the vaccine contains live but weakened virus. You know, the attenuated virus. Live but weakened virus, which means that it cannot cause an infection. And on contrary, on the opposite way, it will help your child build an immunity to the infection, but without developing symptoms. So live but weakened virus help the body to develop immunity, but without developing symptoms. How can I differentiate? She will ask you, how can I differentiate between the normal flu and the flu due to vaccine? Okay, you know, the vaccine can give some flu-like symptoms. You know the difference? The flu itself is presented with bad fever, okay, and some body aches and bad headache and even dry cough. But what will the vaccine cause? The vaccine will simply cause some runny nose. Very simple headache. So the vaccine is just causing like a runny nose or some simple headache. But the flu contains fever and bad headache and body aches, okay, and sometimes even some dry cough, and can last for longer. Okay, now you have to explain. Doctor asked, doctor, what is a flu jab? Again, live but attenuated or weakened virus designed in a way to protect the body or provide immunity against infection without developing symptoms. And please mark this word. It is given as an annual or yearly nasal spray to the children. So it is given as annual nasal spray. Doctor, what age? You know what age? Simply, they start giving it since 2 to 3 years old. 2 to 3 years old. And they give it in the school age as well. And they give it like to the children from 2 to 17 years old with any health problem. 2 to 17 years old with any health problem, like maybe diabetes, like maybe asthma, like anything. Okay, who will give the child the vaccine? Simply, you know that it will be given as a GP by a nurse. How is it given? I told you, it is a single spray, yearly spray. Okay, what is the advantage of the nasal spray? It is quick and painless and work faster. You know, gets more access or faster access to the respiratory system. That's why it works faster. Okay, why children offer it? Why? Because actually, number one of the complications of the flu is many serious problems like bronchitis maybe or pneumonia. So we need to prevent this by giving the flu vaccine. Okay, number two, not only to the children, also to their close contacts. These illnesses, especially the immunocompromised people, okay, this can compromise the health of the immunocompromised, already compromised people and cause some other complications to them as well. So the vaccine is not only for the children, it's also for preventing the spread of the infection to the others. Number three, some children as well, they are immunocompromised. So they need this vaccine to prevent them from developing serious complications. How does the vaccine work? I told you, live but weakened virus. But there is one note that we need to give the new vaccine every year. You know why? Because the flu vaccine keeps changing and modifying itself. The flu virus changes itself. So we need to introduce new nasal spray every year. She will ask you, doctor, are you going to give him a flu bug? Contains live but weakened vaccine. Again. Why it is important again? Why? Because it can cause some serious illnesses like bronchitis and to protect the other people as well and to prevent the spread. How many doses? Single dose. But you know, in some immunocompromised people, like the people who are having some other or under health problem, they can they need to be given 2 doses of the vaccine in each year. Like 2 doses, maybe 1 or 2 weeks apart. 1 or 2 weeks apart, 2 doses. Will it provide long life immunity or lifelong immunity? Actually, it provides only seasonal immunity, which means that it's only for 1 year. So it needs to be given every year. Is there any side effects of the flu vaccine? Like any vaccine, it can have some simple side effects which resolve on their own, like what? Simple headache, simple runny nose. But if you are very worried about side effects, you know, you can contact what? You can contact NHS 111. NHS 111. Again, NHS 111. I'm going to write it to you. We give the 2 doses thing only in case of immunocompromised people. We give them 2 doses 1 week apart or 2 weeks apart. You know, actually the people can take it up to October. The golden time actually is between late August till mid-October, which is basically the autumn. but do not proceed in the autumn. I mean, do not go deeper in the autumn, because it takes maybe 1 to 2 weeks to work. So you need to start in the beginning of the autumn or the end of the summer. What are the contraindications of the vaccine? She will ask you this question. But before asking the contraindications, sometimes, by the way, she can ask you if there any alternative. For the alternative, actually, there is the alternative to the flu vaccine itself. She doesn't want the jab itself. Okay. So there is no alternative to the flu vaccine. So there is no alternative to the nasal flu vaccine or to the flu vaccine. Actually, there is a jab, like injection, but this is not an alternative. We can only consider it in some few cases. But just say there is no alternative to the nasal flu vaccine. Like there is nothing else by the nose to protect or to local vaccine which can protect against the respiratory infection or the flu. What are the contraindications of the vaccine? Number 1, like any vaccine, severe immunocompromisation. Number 2, you remember from the MMR we said allergy to neomycin. But here we are also going to add the egg allergy. So number 2, neomycin, and number 3, egg allergy. Number 4, severe asthma. Why? Because the severe asthma cases are treated with high-dose steroids. And you know, high-dose steroids already immunocompromised, which makes them not entitled to receive the vaccine. So any immunocompromisation, any allergy to eggs or neomycin, any asthma, severe asthma, which is controlled by steroids. Doctor, what will happen if I do not give him the flu vaccine? Actually, simply tell her that the vaccination is optional. The flu vaccine is optional. But here the advantages are very important. Why? Because it will protect your child. It will protect your family from the spread of the virus. Okay? And one more thing as well. This flu vaccine, the nasal flu vaccine, is very simple, and it does not need to be injected. Okay. Now take past medical history. Now, okay, doctor, I will think about it. Now you can take your history, and even you can take it in the beginning, but she will not let you ask many questions in the beginning. She needs you for additional concern. So if this happens, now move to the history in the end. What will be your history here? Number 1, past medical history. Like, has she had has he had any fever or flu-like illness recently? Because I told you that acute infection can postpone any vaccine. Any medical condition? Why? To rule out severe asthma, as I told you. Does she take any medications? Why? To rule out chemotherapy, which causes immunocompromisation. Any allergy? Why? Because I need to ask about allergy to egg or neomycin. Ever hospitalized? Any recent blood products? Because the receiving of recent blood products can postpone the vaccine as well, as I told you from the MMR. Any family member diagnosed with. Now ask about the birthday questions, and that's it. Okay, so now I will keep, throughout the station, I will keep the importance of the flu vaccine and how it protects against flu, and how it's important, especially for the immunocompromised people. And what else? It doesn't cause the illness. Actually, it can cause very mild symptoms, which are short-term. And what else? I will definitely tell her that it's how it works, like it's live but weakened virus. It doesn't cause infection at all. What are the side effects? I told the side effects many times. That's it. This is the whole station. And there is no alternative to the flu vaccine. There is no alternative to the flu vaccine. Okay. Give me 2 minutes break, guys. I will be back in 2 or 3 minutes. Hello, guys. Sorry for the delay again. By the way, we are left with the delayed walking station, a night terrors, and constipated child. We'll do the three of them together with the autism. By the way, I sent a recording to the autism in the group. Has anyone did not get it before? It was an autism. The autism record. Guys, did you get an access to the recording of the autism? We will be left with the autism and chlamydia. Okay, I will repost it. I will repost it. Yeah, it is from the Telegram group, but I will repost it to you again, guys. The autism and the chlamydia and what else? Yeah, this is regarding the pediatrics. The autism and the chlamydia are the only remaining things. We are now left with 3 stations. After doing the 3 stations, we're going to discuss, I'm going to practice quickly 1 or 2 semi stations with you guys. Just one for today, and just to demonstrate to you how it works. And definitely, we're going to start the semi stations. This will be like a separate session for semi. Again, I'm sorry for any inconvenience. The 1 hour or 1 hour and a half session for the semi, it will be maybe on Saturday or maybe on Sunday, as you wish. Okay, so it's all up to you. Just to decide today in the WhatsApp group and let me know Sunday or Saturday, provided that I will mainly arrange them in the morning time, in early morning, not in the evening right now. It will be like in the early morning. And I prefer Saturday as well, because maybe I'm having some errands on Sunday. Okay? Okay. So, next station is the delayed walking. Delayed walking actually started, or it came first in January. Dr. Yasmin, I think it came first in your day.
Yes, I got it. Yes.
I think it came first in your day. Yes, I got it. I think so.
Yeah.
Because I remember.
It came first time on 16 January.
16 January, yes.
Why you guys have titled this as a delayed walking? It was not.
Excuse me?
Why you guys have titled this station delayed walking? It was not.
No, it was not delayed walking. It was just her concern. It's delayed walking, right?
Just the title of the station was Mother has some concern about her son. That's
Yeah, I know. And when you enter, you will find that her concern is delayed walking.
No,
but
delayed, not delayed. She was doing a comparison that and then asking, is there any problem with son? Because why? Then she told me that my friend's son has started walking. I'm wondering why my son is not walking. She didn't never said delayed.
She didn't
asked
what?
that. She never said it delayed. She said, is there any problem with my child?
Okay, so that's how we can call it, because this is just a title that we mean. I will tell you right now how it works. For example, to title a station, we will not write the whole complaint. We will just write, like, for example, concern about delay. Okay, just concern about delayed walking, or concern about not walking.
Mother has some concern about her son. That was the title written in my DMC result. Mother has some concern about her son.
Okay, you know what was? Let me tell you a full list of the stations that were written in my list. Okay, number one. The Ramapur station? It was written blood pressure review. Number 2, morning after pills. Young girl with some issue. So you want us to title the stations in this way?
No, that is the problem. That our understanding, for example, I gave you the example about the breast lump. Breast lump station. I thought, oh, it's a breast lump. I did so superb. When the result came, I failed, and the name of the title was girl looking for urgent referral. That was the title of that discussion.
Yeah, Dr. Yasmin, okay. When you are studying, you can title it anyway. But right now, when you are explaining, I need to put you a list how to follow. and how to remember the station, because if I did not name stations for you, you'll never know how to study them. This
right.
is that's the aim. When I'm arranging the
Yeah.
station and when you are studying, you have to follow lists, otherwise you'll be lost.
Just
Uh,
you can say milestones. Milestones.
yeah,
station.
milestones. Okay, delayed my whatever developmental milestone station.
That's it. Yeah.
Your FY2 working in GP. The mother is 35 years old mother. She has some concern about her 14 months old son, who is not able to walk, or she's not having some concerns according to Dr. Yasmin. What you must do, talk to her, address her concern, special note none. Okay, how we start a station is short of counseling station, right? So, how can I help you, doctor? All the kids I know are walking in my baby age, and he is still not walking. Okay, so now she's showing you that she is worried about her baby or his little one walking. Okay, you seem to be quite worried. Can you please tell me more about it, doctor? Okay, simply, you can now start asking about the other developmental milestones. What are the other developmental milestones? You can ask about anything you wish. You know what? The age of the baby is the age of the one tray is 14 months old. This means that you can ask about most of the developmental milestones. Like what? Number one, can he roll over? Number two, does he reach out for objects? Number three, is he able to make noises or sounds? Because all these things happen prior to 14 months. So I need to check the all developmental milestones. Okay, Dr. Bina, it's fine. Just take your time. Okay, can he hold objects? Is he able to pass things from one hand to another? You know, when you are holding objects, you can, after a while, you can pass them from one hand to another. Is he able to sit without support? Does he respond to voices, especially your voices? Is he able to crawl? And here, this is a motor thing, crawling. So you have to ask here, Mia, know at what age he started to crawl. She can give you normal age. I know this station is about developmental milestones, and actually I did not like the developmental milestones before, but it's fine. Because you need to ask at least like maybe 6 or 7 questions at least, or maybe up to 10 questions in the milestones. Okay, now comes the important question. Is he able to walk on his own? Why? Because this starts happening from 10 months onwards. No, doctor, he cannot stand nor walk on his own. Okay. For example, can he get from lying to sitting by himself? Can he pull himself up to stand? Usually, he is not having any problem apart from the delayed walking. Is he able to bear weight? Is he able to walk holding onto something? So again, the last few questions. Is he able to stand on his own? Can he get from lying to sitting by himself? Can he pull himself up to stand? Is he able to walk? Is he able to bear weight through his legs, which is bear weight? Is he able to walk holding onto something? All these things happen at 12 months. These lying and walking some things happen starting from 12 months. Okay, one last thing, does he respond to his own name or can he say Papa, Mama? Simply, these two things also happen at 12 months. Okay, what are the differential diagnoses? I asked about the associating symptoms, which are the developmental milestones. What are the differential diagnoses? You can ask about osteogenesis imperfecta, like any fluid discoloration in the eye, rickets, any bowing in his legs, any movement difficulty, like any difficulty moving the arms or the legs, apart from walking, any moving difficulty. Those are the DDs here. In the past medical history, I just can ask about fever or flu-like symptoms, right? Very important. Family history. Family history, you can ask about any chance any of you or your father had delayed walking or started walking recently. Actually, sometimes it can be due to some family or runs in families as well. So please do not forget to ask this question here. Now ask the birthday questions. Very important. Ask them normally. What is the management? Doctor, why is he not walking? Okay, very simply that you will tell her mostly related to their nature and their readiness to walk. And sometimes the genetic play a role here in this case. So simply reassure her and tell her this is simply related to their nature and the genetics play a role. So it's nothing to worry about. Doctor, at what age should they start walking? You know, most of the children are able to walk alone by 11 to 15 months. You know, he is here 14 months old, but they are able to walk at least up to 15 months. And it's variable from one baby to another. Okay, when it can be delayed or it can be considered to be delayed if it's not achieved by 18 months. Okay, so when should I worry? When it is beyond 18 months. Now you can be worried. When will he be able to walk? Okay, usually the baby starts walking or able to stand up and walking maybe between or around around 11 or 10 months. They usually start walking around 10 or 11 months. Okay, this is usually. However, if his walking is delayed up to 18 years, up to 18 months, we can definitely examine him again. This is the thing. I'm going to give her a few advices right now. I'm just addressing her concerns. She will ask you up to what age for babies not to walk. I said about 18 months. But one more thing, guys, bottom shuffler. The bottom shuffler are the babies which is the opposite of the crawling. So you know that the babies who are bottom shuffler usually work or walk later, start walking later. So this is the thing, just reassure her that even if it's delayed to 18 months, this can happen with the bottom shuffling. So now she will ask you a few questions. What can I do? Will you refer my baby doctor? Okay, number one, we will give her some advices not right now. Which advice is here to be given? Number one, record book. Always follow his record book. Number two, if you are still worried after 1 month, like when he is 15 months old, come back to us to examine him, and he will be referred to be seen by specialist after 1 month from now. Okay. And if he is referred, he could be seen by pediatrician. You know pediatrician? He's a specialist in child health. He will do some tests to him, okay, to assess his development, and he may refer him to physiotherapist. So again, I will advise her about the record book, and after 1 month, we can refer her to a pediatrician to assess his condition or his development, and we may refer him to physiotherapist to aid him in walking. Okay. Now she will ask you, doctor, what should I do for him, or how can he learn to walk? Now, actually, you will advise her that you will give her some few advices, Dr. Zaid. What are the few advices here? Now, you can ask her to let him stand up on his own. Like you have to encourage him to stand on his own without support. And when he starts to pull him up to stand, either with aid or without aid, right now, after a while, he can walk with support. So number one, encourage him to stand without support or with support. After that, encourage him gradually to stand without support. After that, actually, it's very helpful if you let him walk like touching to the furniture or holding the furniture. And some helpful advice as well. You can help him to walk by many reasons. Number one, you can provide him enough space to walk, like maybe in a big room to walk. You can also advise him to walk, or you can encourage him to walk by what? You know, taking the shoes off, because they will be more free. If they are running or if they are walking without shoes, they will be more free and they can do it freely without any restriction. You know, like any mother, we are going also to advise her that you sit or you stand at a distance from him. Why? You know, like standing at a distance from him to just to encourage him to come to you. Like with opening your arms and start like encouraging him at a distance from you to encourage him to come from a distance to you. This will encourage him more to walk and will be more motivated. Actually, yes, this is psychology, because sometimes it happens due to that he's not having the desire or he's not feeling like walking. He's a lazy boy, maybe. So now her mission is to encourage him. So feet free, enough space, and stand at a distance from him. Okay, this is very important. And please make sure that his environment is safe. This is very important as well. Why? Because actually we need to prevent the fall and we need to make sure that the floor is very fit enough to that. She will ask you, doctor, but my baby is 14 months. Should I be concerned that he is not walking yet again? She told you that he stands on his own, which means that he is able to bear weight. Okay, which means that nothing to worry about. He is already having the interest to learn the skill, so he can start walking soon. Okay, those are the important things here. Actually, the walker is not preferred. You do not prefer the walker, Dr. Zaid, because the walker will restrict him. We need him to rely on his own. I told you that if she is concerned more, she can come after 1 month and they will refer it to pediatrician. Why? The pediatrician will run some tests and he can refer him to physiotherapist. This is the whole station. I think it's only about reassuring and encouraging how to learn him or how to teach him to develop walking. Okay. You can also advise here about exposure to the sun exposure. Why? Because it contains, sunlight, like they will provide him with vitamin D. Okay, this also can help strengthen his bone. Number two, stations night terrors. Night terrors is the easiest station which came so far, and the new stations for the pediatrics. In the night terrors station, simply, I tell you something. Your FY2 in GP clinic, the lady is presented because she's worried about her 5-year-old daughter. Okay, I need someone to work on it smart. I don't need someone to rely on the script in this station. Dr. Yasmin.
Dr. Ahmad?
Yeah.
I had this station. It came very first day when I had it. So
Yeah,
basically it came the very first day. When I went in, there was a woman. She was sort of
Which one?
whatever woman. At this night terror.
Oh, okay.
That was the very first time when it came in.
Okay.
So I went in and there was a woman and she was just sitting down like sort of unhappy woman. And she said, my child is waking up at night. And from there on, I asked everything. I elaborated. Would you please tell me more about your child? Jasmine, I really remember her name. Would you please tell me all about Jasmine? Is she a happy, healthy child? Yes. When does she feel sick often? She said no. When was the last time when she was seen by doctor? I said, I don't remember. I said, maybe when she had the last vaccination in 3.5 years. Oh, maybe then. And is she happy? She's very happy child. Asked about the school. Maybe something upsetting her. She said no. She goes to school. So maybe it's related to school. When the school started? Yes, it's started after. She said that it started after when school started. So maybe there is a reason. Why don't you go to school and ask the teacher? I said, I went. What do you think? I went there and asked. Teacher said that she's very happy there. Does she have a friends? Yes. Maybe she's being bullied? No. And I didn't know what else to ask. I asked
Family history.
myself. I said,
Family history, Dr.
That's the problem. I never thought about the family history. I even asked about her husband. Maybe they argue in front of her. Maybe that is boring a child.
No. Wait. I mean, like family history because it can happen to her. It runs in family.
Yes, by then I had no idea about this night terrors at all. That's how I did the station, and I failed it. I literally asked everything. I thought maybe there is abuse. I asked about the father. Is he biological father? What is their relationship? And in the end, I said, to be honest, I don't know what is going on. But I'll have to talk to my senior. Would you please bring her back urgently, your child, and we'll have a look. That's all of what I said.
Okay, let me tell you how to elaborate this station because actually I was having some like specific approach for such stations. I'll tell you now.
Yes, please.
Dr. Muniba, you scored 9 in it, right? Can you share your experience in 2 minutes?
Well, I asked almost the same question as Dr. Elvira asked. It started with how did it start? Does she wake up in the middle of night? Does she remember the things in the morning? Has she started school and recently? Have you changed your home environment? Is she being bullied in the school? I made a mistake. I didn't ask about the family history, but the rest of it, I asked about the PMH. I asked about the birth question. Then later on, I reassured her that it's nothing to worry about. It will just she will get over with it with time, and don't try to frighten her or just make the environment relax. This kind of stuff I said in the mind.
Okay, what about the management?
Sorry?
The management. What did you tell her in the management?
Well, I told the mother that she doesn't need to worry about it. She will get over with this with time. And one second, what did I say? Yes, and also that she doesn't. If she wake up in the morning, don't try to ask her to recall everything what has happened. Just act naturally with her like this.
Perfect. Thank you, Dr. Muniba. Okay, let me tell you the approach to these stations, guys, in any child psychology or any child neurology. You know, Dr. Elvira, what you are supposed to do? This night terrors is an episodic, right? So I will treat it, I will consider it like epilepsy. You know how I elaborate the epilepsy or the fits? Before, during, and after. This will be my data gathering. And this is child psychology. So I will need to take some short image, and after that, the famish social history. After the famish, one important question to be asked in the child is who looks after her. And I can also ask about the bird questions. Let's start this station. I will need to finish it in 5 minutes. Number 1, she will tell you about the condition, the whole condition, that she wakes up in the middle of the night having some fears or some terrors or some sort of like panic attacks. She will tell you whatever. Okay, I can see that you're quite worried. I'm going to ask you a few questions about that. Now, before the episode, what happens? What can happen before the episode? Number 1, does she empty her bladder regularly? Or does she empty the bladder? No, first, not before that. Before the episode, at what time does she usually go to the bed? This is number 1. Number 2, does she empty her bladder before going to bed? Number 3, do you think that she watches anything scary in the TV before going to bed? Does she spend much time on internet or TV usually? Those things can trigger these things. So internet, scary movies, empty the bladder. And at what time does she go to bed usually? We ask this question. Number 2, during the episodes, at what time the episodes happen? Does it happen at fixed time or regular time each day? She will tell you usually at around 1 or 2 a.m. every day. So now the time is fixed. Number 2, can you explain or can you discuss the episodes precisely to me? She will tell you exactly that she walks in the middle of the night, she screams, she shouts, and she utters many strange words. And after that, she goes back to the sleep peacefully as if nothing happened. Okay, this is an episode, right? I asked about the timing. I need to ask how long it lasts as well. She will tell you maybe 1 minute, 1 or 2 minutes. Has she gone mad at you or has she tried to hurt anyone before during this episode? No. You know, when the children are having this problem as well, they tend sometimes to have like involuntary walking. You know, walking during sleeping, and sometimes you tend to be having urinary incontinence. So you'll ask her, by any chance did she walk while sleeping? By any chance did she wet herself during sleeping? So the timing, number 1, number 2, the description, number 3, walking, number 4, maturation or urination. What happens after the episode? She goes back normally, doctor, to sleep as if nothing happens. Does it happen again after the first time? Does it happen again many times in the same night? No, doctor. Okay, after the episode as well, do you discuss it with her when she wakes up in the morning? No, doctor, I have never tried, and she didn't even mention about it. Mark this word. Please mark this word that she never mentions about it. Okay, now ask about some past medical history, like how was her health recently, any fever or flu-like illness, any constipation, because constipation can cause stress as well. Any medical condition? No. Any family history of similar problem? No. By any chance her father was having? No. Now move to the bird questions. Not significant. Now move to the famish. Social history. May I know whom does she live with? She will tell you she lives with me and her father. Or my partner. Sometimes she can tell you her father, and what she tells my partner, you will ask about if he is a biological father or not. And how is her relationship with both of you? Any brothers or sisters? No. Does she have any problem or any stress at home? No. What about her friends? Doctor, she started going recently to the nursing school. I'm not sure about people there. Sometimes. Don't you know about her relationship with the others? Doctor, I think it's fine. No problem with that. Did she ever talk to you about any problem in the... This comes under the friend. In the nursery school, I'm going to ask it in the friend section. Did she ever complain to you about such things? No. Or any problems? No. Okay. Is she coping well with her study? This is the study. The F is finance and sometimes study. So is she coping well with her study? Does she have any stress in her study? No. Okay. Now I need to ask one question. I asked about it. Who looks care after your child? She said me and her father. Okay, very good. May I know if this had affected her life or if this had affected her daily activities or something? No, doctor, it hasn't affected anything. So now I asked about everything: PMH, birth question, and social history as well. Okay, now move to the examination. She is not here. She is not here at all. But from my assessment, it seems that she is having a condition I call night terrors. Okay, guys, so here you have to explain to her. Okay, wait, guys, wait 2 minutes, I will be back, okay? 2 minutes exactly, I'll be back. Hello? Okay, excuse me guys for the delay, I'm sorry. So, Famish questions, Dr. Zaid, again. Famish are family, friends, finance, and forensic. Of course, in the children, you'll not ask about the forensic. And you will not ask about the alcohol, you will not ask about the mood, you will not ask about the insight, you will not ask about the suicide as well. You're not going to ask about hallucinations. I, insight, S, suicide, H, hallucinations. M is mood and mental health. A is alcohol. So I will end up asking about the F only, which is a famish, the family, friends, finance, and such things. Okay? Okay. Um, I'm going to tell her that you're having a condition I call night terrors. What is this condition, doctor? Now you have to explain everything to her. What is this condition? It's very important. Tell her simply night terrors. Night terrors actually they are a common condition that happens in the children between 3 to 8 years old. So it's common up to 8 years old. And it happens in episodes in which the children are not fully awake, okay? But they scream and say many words, many ununderstandable words. And they look like panic. You just explain the episode to her. And it occurred early at night. And it continued for several minutes. Why does she have it, doctor? Okay, simply it happens either for family history, it can happen, and it can be attacked or it can be triggered by some factors. Like what? Like, for example, it can be triggered by the deep sleep. Sometimes it can be triggered by very deep sleep. Sometimes it can be triggered by having an infection or in stress in her life or in anxiety. So deep sleep, stress, and anxiety, plus family history. One important question, are they different from nightmares? Yes, they are not nightmares. They are very different. What is the difference? The difference is that actually here it happens during the deep non-dream sleep. So it happens during the non-dream sleep. While in the nightmares, it happens during the dream sleep. One other difference is that in the night terrors, the child wakes up in the morning without any memory to this condition. But in the nightmares, he usually or she usually remembers and she talks about everything in the next morning. And usually it is preceded by frightening experience in the nightmare, but not necessarily in the night terrors. Doctor, is it dangerous? You will just tell her that most of the children will grow out of it. What are you going to do for her? We may need to reassess her or review her. So you can bring her later. Okay, we need to do some tests to her, some blood tests, and to check her tonsil and her chest and her like ENT and chest examination and tummy examination and urine examination. Okay, that's it. When we are going to refer her to specialist, if this affects her sleeping and is this affected or it happens more than it should happen. What can I do for her? You know what to do for her? Here simply, I'm going to give her some advice. Number one, try to talk to the teacher in the nursery school. Explore her study or explore her condition. This is number one. Number two, please, warning sign, do not ever wake her up or try to interrupt her while she's having this. Why? Because she will get more anxious and she will end up having aggressive behavior. Like the fit exactly. Do not interrupt someone who's having fit. And also try to talk to the teacher when someone is having fit, right? Here also you will talk to the teacher to find out, or the social advisor in the school. You will talk to her to find if she's having any stress or any problem or any bullying in the school. Usually it coincides with the school age sometimes, or it's increased in the school age. You know why, guys? Apart from this situation, usually the night terrors are increased during the school age or entering the school. This is a new life to the children, more stress and more anxiety in coping with the society. So this may promote or boost the night terrors to them. Okay, so I'm going to advise not to interrupt, to talk to the teacher or to the social advisors. That's number two. Please, number three as well, do not talk to her when she wakes up in the next morning, because this will make her more stressed about it and she will lose confidence in herself. Try to talk to her as well and follow her behavior or her activity, her daily activity, to consider or to explore if she's having any irregular or abnormal thing which can precipitate this fit or this episode. One funny advice or one interesting advice is that she can also wake her, she can wake her a few minutes before the episode comes to interrupt the episode or to interrupt the cycle. You know, if I know that you're going to have a fit in 5 minutes, I am going, for example, to try to distract you in this time. For example, I know that you're going to fight with me in 5 minutes, so I'm going, for example, to do anything to avoid you. This is the same thing. I know that you are going to have that night terror in 5 minutes from now, so I'm going to wake her up right now so that she will not develop the night terrors after 5 minutes. This is called cutting the cycle. So this is the station so far of the night terrors. Very easy one. Neurology and psychology are very similar. Has anyone got any question? Has anyone got any question? Dr. Elvira, is it clear right now? Dr. Elvira, tell me, what could you have missed here?
So obviously by then when I went there, I didn't know, I had no absolute idea about that night terrors. And I didn't actually relate it to the family history at all. And I didn't, because I didn't know what was that. And I just told her. And here it seems as clear there is the steps, the certain steps you have to do, certain advices you have to give to the
Yeah, so it's basically, it's basically about reassurance and
reassurance.
Yeah.
Just leave the child and she will grow out of it.
Yeah, exactly. She will grow out of it. Just reassurance and such things.
Yeah, be more attentive to a child. This is some sort of. I don't believe that it happens just in the middle of nowhere. There should be something which the child is going through, some emotional, psychological turmoil.
Yeah, exactly. It is about stress.
Yeah, just be attentive to a child and try to find out the reason appropriately. So.
Exactly.
Dr. Ahmed, the last question was asked by one of my friends that by what age this condition will go away? By what?
8 years. 8 years.
8, yeah. So I should reply like as the range of this condition is between this to this. At this time she is 40-year-old, so by 8 years it will go away. So then she asked that it means there is a chance that it can occur again. It can happen again.
Okay, simply I tell you something. What happens, I'm speaking now not from the PLAB experience. I'm speaking about from my experience, which I saw like in the pediatrics work. What I saw that, and even in the psychology of pediatrics, is that Dr. Yasmin, some children actually are having this problem up to 12 or 13 years. And they are not children. They're just kids right now, or even more than kids, or teenagers. So, Dr. Yasmin, this time it can take them a little bit longer. Like, for example, instead of growing out of this condition at 8 years, they can grow at 13 or even 14 years. But most of the children, not most, all the children will grow out by maybe 14 years old. So it can take a little bit more time. However, if it continues beyond 8 years, what we can do, Dr. Yasmin, we can start psychotherapy.
Psychotherapy by contacting GP.
Exactly. So psychotherapy, this is number one. Number two, of course, we will be definitely like exploring her social aspects, because definitely there could be a reason to that. And we will again give the same advices. But here at this point, she may need psychotherapy. And actually, by the way, if it continues after 8 years, it will more likely happen with nocturnal enuresis.
Yeah. So there are criteria to make a referral to the GP. For example, the frequency of episodes are more, or if more than 3
the chart.
Yeah. Then if it is affecting on daytime activities like in the school or any activity. And third one is that like if it is beyond 8 years, then we should refer the child to GP to arrange a psychotherapy session.
Yeah. This is very simple, because actually, if it can recur after that, we'll just try to be diplomatic. Don't say yes or no. Well, actually, it can happen in rare cases. However, in this case, we are here to help and support her as well. We're going to re-examine her, and we will offer her the best support and best care as well, till she grows out. This is it, because you're not supposed to know about each and every prognosis for all the diseases. You just need to know fixed answer. However, if this happens, we know how to deal with that, or we know how to support her.
Yeah, you can just say like generally this type of system get over by the age of 8, but if it occurs like after 8, we will review you again. And if needed, then at that time, like that, we
Yeah.
generally cover the topic generally. Because it's variable. In children, it's always variable. Pediatric cases. Everything
Yeah,
is variable.
because you know, actually, I believe that remembering all the scenarios or all the prognosis of all the scenarios is very unfair. I mean, even as not even as FY2, even as a specialist, to remember all the prognosis to all the diseases, this is something insane, seriously, to be done.
It's always have a diplomatic answer ready there.
Yeah, just have this answer in your mind.
Okay.
Okay. Anyone needs to ask any question further about the night terrors? What bookish? Oh, yeah, they are so bookish. You know, they are. I mean, wait. I just need to stop the recording. You do not know how to know the reason. I mean, like to show that you know the station beforehand can piss off the examiner or can piss off even the patient themselves. So what are you going to do? Number one, simple. Are you following me, Dr. Nigar?
Yeah, I'm following.
You number one always rule out infection.
Okay.
Why? Because infection is the most common cause here in the children. To have prolonged constipation, maybe. Okay. To rule out the infection, any change in the bowel habits, maybe any fever or flu-like illness. This is number one. Number two, what are the other causes of constipation in children? As you said, could be sometimes dietary factors. You know, one important reason as well for the constipation in children, for those who are having children, they know it's better than me, of course, that the children are not potty trained. Potty trained, which means that they are not trained to sit on the toilet.
Yeah, this is another reason.
Yeah, this is, you know, this is sort of, I mean, they are not trained, they are fearing the experience. So that's why, you know, they end up having constipation because you do not want to go to it to the toilet or to the loo. So this is one reason of the constipation in the prolonged constipation in children. So most importantly, infection or bowel problem. Number two, dietary habits. Number three, some stress, which is potty training. Right?
Yeah.
What else? I could say dietary factors. Dietary factors is not only about what he eats or what she eats. No, it can be also about what his parents introduced to him.
What did you say? I didn't get it.
What age? I mean, sorry, not what age. Sorry, what his parents are introducing to him. For example, he can be eating or he can be enjoying everything, but the problem is that the parent, the mother herself, she doesn't care for his needs. She doesn't provide him with a suitable fruits and vegetables, right?
Yeah.
So it's not only about his preference; it's also about what he's introduced, what he's given, right?
Yes.
Did you get my point?
Yeah, I got it.
I hope so. So, Dr. Nigar, your FY2 working in GP clinic. The mother has presented to the clinic because her 3 years old son, yes, KFC Dr. Zaid, exactly. 3 years old son has constipation. She presented to the clinic 2 weeks ago and dietary advice was given. So he was given dietary advice, but his condition didn't improve. And the GP note states that new neurological problem. You know why they say, give me a minute, guys, sorry, give me a minute.
Can anyone tell me what range of age we are talking about? I mean, up to 10 years they are children, not they? Please, anyone answer?
At 3 years plus, Dr. Alvira.
Okay, guys. So, the GP note writes that no neurological problem has been detected and no abnormality on the abdominal examination. Only one thing, hard feces is palpable on the lower abdomen. You know what is the meaning of hard feces, Dr. Nigar? Remember the station of the post-operative constipation? She
Yeah.
was having fecal impaction, which makes her, or due to the prolonged constipation, which
Yeah.
leads to tummy pain in turn. So hard feces means prolonged constipation. So it's very simple and very natural with someone who are having prolonged constipation to end up having hard feces. All right?
Okay.
Okay. What you must do here, talk to the mother and address her concern. Okay, Dr. Nigar, she is very
Yes.
angry sometimes, or she is very concerned. She will tell you, Doctor, I'm not happy. By the way, I got this station in my exam. I got it and I got 11 in it. Okay? I will tell you right now one or two things I did in this station after finishing it. Actually, it's not a magic. What I did in this station, very simple. I kept reassuring her that we are all here to help you and address all your concern. Why she's angry or why she's concerned? Because she thinks that the GP has ignored or has overlooked her little one by just giving him some simple advice. She just told me that he just gave him simple dietary advice, which didn't help him, and I need to know more about it, please. I'm really not happy. So you reassure her, we're all here to help you. You start the constipation. Like, for example, since when it started? 2 months, doctor. And what about, for example, when was, usually, how often does he go to the loo per day? Doctor, actually, doctor, it's not a per day right now. He just goes once per week right now. When was the last time he opened his bowl? She will say 7 days ago. Can you imagine? 7 days ago he opened his bowl. What comes after opening the bowl, Dr. Nigar? Remember?
Is there anything else?
Dr. Nigar, when someone does not open the bowl, I need to ask a very important question.
Oh, what about we?
What do you mean?
Like,
No, I'm
if
just asking. I'm just asking about the constipation so far.
okay.
No. When someone is not opening the bowl since 1 week, guys, what is the red flag that I suspect? No, it's an
But
obstruction.
we.
Yes, when? Thank you, Dr. Kashi. I need to ask one question. When was the last
Oh,
time he passed wind?
what about the wind? Wind. We need to ask. Does he pass the wind?
Yes, wind, exactly. Yeah. Sorry, I heard it something else, Dr. Nigor. I'm sorry. I heard it we in the beginning. I'm sorry. That's my bad. Okay. So you will ask, when was the last time he opened his bowl and when did he pass wind?
Yeah.
Always ask, what about when it started? What about when it started? What about when the whole problem started? She will tell you, doctor, he used to go to the loo 3 times per week.
Okay.
Okay. And he passes hard stool, but no blood in the stool. So again, to elaborate the constipation, when did it start? How did it start? Okay. Tell me, how often does he go to the loo? Once per week, doctor. What about when it started? It was twice per week. When was the last time he went to the loo? 1 week ago. Did he pass any wind? Yes, doctor. This morning. So I ruled out intestinal obstruction. What was done by the GP? He gave him some dietary advice. He said it's nothing. It will go away. Doctor, but it didn't. It didn't go away. What else does she? What else? I mean, ask her anything more. She will tell you, yes, doctor, he's having pain while passing stool. Since when? Together with the constipation. Has it changed? No. What are the associating symptoms here, Dr. Nigar? What could be?
Um, what associated symptom like
Tummy pain, vomiting,
tummy pain and
vomiting.
child more like a
Listen, simply,
angry. Child
simply.
will be angry, more angry.
No, simply. Associating symptoms for the constipation. What did I
Oh,
say? I said associating symptoms are, number one, overflow
yeah.
area. When someone is having prolonged constipation and ask by any time any overflow area, no. You know, prolonged constipation also can cause tummy pain. So by any chance, any tummy pain? No. What about any fever to rule out infection? As we said, no, doctor. So those are the important things: fever, tummy pain, and overflow diarrhea. What is the red flag here, Dr. Nigar?
Any bleeding, parectal bleeding?
Red flag, Dr. Nigar.
Uh,
When I say
okay.
the word red flag, I'm pointing toward two things in the whole stations of pediatrics. They are dehydration or meningitis. What would you pick up
yeah,
here?
dehydration.
Yes, definitely. Thank you so much, Dr. Nigar. So ask about dehydration. Does he feel thirsty these days? What about his mouth? Is it dry? Very simple. Okay. Okay. Now ask about the past medical history. All of it is not significant. For example, was he diagnosed with any bowel problem, any medical problem? No. Ask the bird questions, still not significant. But very important, Dr. Nigar. Here, you know that the GP pointed out that the reason was dietary reason, right? So when you come to the D, you have to be stressful. How to be stressful or stressing here? I will tell you how. What about his diet or what about his feeding? He feeds well, doctor. Any recent change in the diet? No, doctor. But you know, he doesn't like to drink water and milk, doctor. Also, he doesn't like to take fruits and vegetables. He just likes cereals. Whenever we go, she will tell you a very big story. Whenever we go to the grandmother, she gives him pizza and pasta. Okay, so now you know that it's pure due to dietary advice. Now you can ask also some questions. One question is the potty training. Is he potty trained? Yes or no? It depends. I remember in my day that she told me that yes, he was potty trained. Does he have any fear about using the toilet? No. Does he have any stress or any problem, like in his school or in his home? No. Does he soil himself? No. So again, potty trained, number one. Number two, any anxiety or fear of using toilet? Number two. Number three, any anxiety or any stress in anything in his life? Number four, does he have any problem in school or nursery? Number five, does he soil himself? Those are the most important questions. Okay, Dr. Nigar?
Yes.
Clear so far?
Yes.
Okay. What examinations are we going to do here?
Tummy examination and parectal.
Thank you. Thank you. Thank you so much, seriously. Okay. The task will tell you, or the examiner will tell you, doctor, the examinations are similar to the GP findings or the task findings. Doctor, so what could be the reason? You will tell her that the reason is due to what, Dr. Nigar?
Due to dietary habit.
Exactly. Oh, doctor, you're telling me dietary habits again, like the GP or like the previous visit. You now you have to explain yourself because he's not taking enough fruits and vegetables and not drinking enough fluids or water. So, doctor, what can be done? Simply give some dietary advice, like advice about more fluids, more fruits, more vegetables. You told me that he doesn't like water or milk, right? Right, doctor. You know when someone is not liking anything, Dr. Nigar, I'm sure you experienced it with this as a mother. When anyone does not like anything, we usually crush it or we make it in a form of smoothie, right?
Yeah.
Like for example, you may try some fresh fruit juice or some smoothie for him to like the fruits and vegetables, or to like the fruits only. So simply, if he does not like the fruits or the fruits, just make them in the form of smoothie. How long will it take? Usually, it will take just, it can take, it needs a little bit of patience. However, usually with the lifestyle advice, it can take maybe a few months. Are you going to prescribe? Yes, I will tell you what.
What did you say?
Wait. I will go. Wait. I'm going to tell you everything. Are you going to prescribe any medication, doctor? What you're going to say here?
Laxative.
You mean laxative? Yes?
Yeah.
No, just simply ask her, do you have any concern? Yes, doctor, aren't you going to give him any laxative? You will tell her that laxatives are recommended for children who did not manage or having some problems still along with the diet and lifestyle advice. I mean, which do not improve along the diet and lifestyle advice.
Okay.
And it can take up several months for the treatment to work. So why? So the treatment can take up to several months to work. That's why always keep the dietary advice as a priority. That's number one, because it's very essential even for the laxative to work or to keep working. Number two, know that sometimes when they start having or like pooing normally, they can overflow or soil themselves. Okay? So make sure about that. Number two or number three as well. They can continue laxatives for a while even after the condition is settled. Why? To maintain the soft poo. Otherwise, it will recur again. And in the end, you can advise him how to, for example, advice about toilet or potty training. Okay, have the habit of going to the loo every day or every morning to get used to the bowl habits or to the toilet. So again, dietary advice number one. Number two, laxatives can work. You know, dietary advice can take some weeks. Okay, not months. I'm sorry, some weeks. But the laxatives can take some months. That's why I'm advising, like I'm giving the lifestyle or the dietary advices along the laxatives, because the laxatives can take some time. And also the laxatives may cause him to develop some oversoiling after the wee becomes soft. So please take care of that. And we may need to continue the laxative for a while after the symptoms resolve to keep soft stool. And after that, I'm going to advise her to train him to go to the loo every morning. Very simple station, right? The only cause here is the dietary advice or dietary habits. Okay?
Okay.
Okay, so we are finished for today, guys. Tomorrow we'll be having the session at 8 a.m. UK time.
Dr. Ahmed? Hello? Dr. Ahmed.
Zaid, I think he's gone.
Yes. No, he mute himself.
Okay, excuse me, guys. So, tell me again.
Yeah, Dr. Ahmed, how are you? Hi, sorry. So, just regarding the differential diagnosis in this case, so, you know, how we can ask about them, what differentials for the constipations?
Okay, here you can ask simply about the infection.
Oh, fucking infection.
Yeah,
Yes.
and also you need to rule out the dehydration, Dr. Zaid. This is a red flag. And you need also to rule out intestinal obstruction.
Okay.
How to rule out intestinal obstruction?
Yeah, the vomiting and abdominal extension, swelling.
And passing wind.
Passing wind, yes, those are most important questions. What about,
wait,
can we
need also to ask some alteration, like any previous episodes. Any previous episodes, like say, for example, any prolonged constipation with overflow diarrhea can be due to like inflammatory bowel disease. However, it's very unlikely to happen in the small children. But it's fine, we can ask about it. Maybe also we can ask about piles. You know piles by asking any blood in the stool when it happens? No.
Yeah, piles or anal fissure, yes.
Yeah, very simple. So, but just your main DDs are dehydration and infection.
Right. Those are the main DD.
Yeah.
But cannot we ask about because it's written in the stem of the question that he was seen by dietitian.
He was seen by GP.
So, and dietary advice was given to him, right?
Yes.
Okay. But you know, okay, I understand. Because you know most of the constipation in children is because of the dietary and the liquid. Yeah.
Exactly.
Yeah. Okay, thank you, Tigger.
So any further question, guys? You have 16 hours hospital. Yeah, I think it's uncommon, by the way, but you know, anything can happen. Actually, sometimes it can be due to some weakness. You know, due to prolonged constipation, prolonged strain, Dr. Elvira. So you can just ask about it, like any blood in the stool. Very like simple question. 16 hours hospital duty tomorrow session time is same or different? No, Dr. Maria, tomorrow session is 8 a.m. UK time. 8 a.m. UK time, and please attend your shift. Tomorrow's session, I agreed with you that it will be recorded. I told all of you that it will be recorded. Yes.
You said that you had this station. Was she actually persuaded by the end that she had
she's
to
very
change?
nice. Yes, she's very nice. Listen, Dr. Elvira, I have my own way of giving advice. Like, for example, I believe that any station which contains lifestyle advice, you have to be persuasive. You do not need to be informative. You need to be persuasive. I will tell you something. I used to tell her, for example, well, you told me that he goes to his grandmother, which I'm sure she prepares for him all the delicious food, like the pizza, the pasta. All of us know, all of us like it, especially him. But what about trying some other different foods sometime, especially telling his grandmother about that? Like, for example, trying some fruits and vegetables. She told me, yes, it's a very good idea, but I don't know. He doesn't like these things at all, doctor. Well, I'm sure that, you know, always like children these days, they like the new food or the fast food, and such the pizza and the pasta. They are very delicious. But we can work on that as well. For example, we can make it in the form of smoothie. We can make it in the form of juice. Did you try that before? Or did you try to smash them before? Oh, no, doctor, this is a good idea. Yes, I'm sure, and you will like it more as well. So that's it. I asked her also about the putty training. By the way, you told me that he's putty trained, right? She told yes. By any chance, have you tried to? By the way, there is something snipping. You're playing with the pen, right?
I am. Yeah, I'm sorry.
No, it's fine. So the thing is that by any chance, have you tried encouraging him to go to the loo every morning? No, doctor. I don't try that, or I didn't. Actually, you should do that, you know, because this is very important for his bowel habits. In case you need him to recover and stay longer, or stay, his bowel habits to stay like regular, you should do that to him as well. Meanwhile, do you have any other concern? Yes, doctor. Aren't you going to give him anything? May I know, like, what exactly, or what's your concern? She told me about the laxatives. I told her, well, this is a very valid question. Actually, you can prescribe him laxatives as well, but you know, the medications in this case can take a little bit longer to work. And also, they need some sites or some work from our side, like what I told you about the foods and what about the putty training and these things. So it's always advisable to keep the lifestyle advice hand in hand with the medications. Okay, doctor. Also, one more thing. When the medications start working, they may tend to have like to soil himself. So please mind that, please. And always try to talk to him. Do not let him feel embarrassed about that. Okay, doctor. Thank you. It was a very nice station. I finished it maybe in 6 or ultimately 7 minutes. Just about dietary advice. Okay. Anyone has any questions so far? Regarding tomorrow, it will be 8 a.m. UK time, inshallah. And one more thing. The Simman will be Saturday. Simman will be Saturday, and I will post the timing tomorrow, inshallah. I'll post the timing tomorrow, the exact time of Saturday session. Let me tell you one thing before you leave. Tomorrow, I will not, what I will do tomorrow, I will bring the examinations. I will revise quick tips about each examination. Okay, the station itself is known, but what I need to do is to discuss the examinations themselves. How to, for example, some important points not to miss in the examinations. Usually the management and the history are very short in such stations. I just need to discuss the examination with you. And with some of the teaching stations, but not all of them, because we will not be having time to that. In Saturday, inshallah, it will be maybe a 1.5-hour session, and it will be basically for the same man. What will happen? I will pick up people to practice Simman stations before my eyes. I just need to test you like maybe like 6 stations of Simman out of 9 or 10. At least to know how to approach them and to be familiar with the Simman approach. Just please listen to the recordings. And what happens is that when you are going to your academy, or when even you are doing it, or when you are even studying it, just try to follow ABC. I don't need you to follow the script. I need you to follow ABC. Look at the monitor, pick up what happens before your eyes. After looking at the monitor, you can address anything. Like, try to be retrograde. Try to be a doctor. Do not try to be a retrograde doctor. What do I mean? Like, for example, do not say, the script says that right now I should give adrenaline, though the oxygen is still low. So I still need to give this. No, actually, the adrenaline is part of the oxygen as well. So here I need to address the thing, and after addressing the oxygen and the airway, or the airway and breathing, move to the C, which is circulation. You have to be very organized. A, B, C is only what matters. If you follow this, even if you don't know the script, you will pass it. But if you follow the script without following ABC, you're not going to pass, because you know what? They change the finding every time. There are 10 stations so far, Dr. Rivera. There are only 2 from the older pattern, which are the AF and the UTI with confusion, the SEMMAN. Both of them are from the older pattern. They don't come anymore. 9 new stations come, and 1 station came first in the beginning of March, which is a heart failure. I'm going to provide you with it. Did you listen to the recordings of Rivera? You didn't. You have to listen to them, okay? Are you sure? Okay. So, guys, thank you for listening today. Tomorrow, inshallah, will be 8 a.m. UK time. By the way, it will be from 8 till 11, and after that, I may take a break for the prayer, and we will be back to resume them. For a while, it will take us maybe half an hour or 1 hour more.